Live stream is up. Sergeant, please start your recordings.
Recording to PC in progress.
According to the cloud, all set.
Backup is rolling.
Okay, Sergeant Jones, you may begin with your opening statement.
Good morning, everyone, and welcome to today's remote New York City Council hearing on the Committees on Finance, jointly with Environmental Protections, Hospitals, Higher Education, and Governmental Operations. At this time, would all panelists please turn on their videos? And to minimize disruption, please place electronic devices to vibrate or silent. And if you wish to submit testimony, you may do so at testimony@council.nyc.gov. And again, that is testimony@council.nyc.gov. And thank you for your cooperation. And Chair, we are ready to begin.
Thank you very much, Sergeant Jones. Thank you to the Director of Security, Carl Dalva, and to all of the sergeants for the work that you do to make these hearings possible. I'm most grateful to all of you. Thank you. Good morning and welcome to the City Council's 8th day of hearings on the Mayor's executive budget for fiscal 22. My name is Daniel Drum and I chair the Finance Committee. We are joined by the Committee on Environmental Protection, chaired by my colleague, the famous Council Member Jim Gennaro. And I have to say, it's a great pleasure to be able to work with you, Council Member and Chair Jim Gennaro. The first time we've had a hearing together after knowing each other for many, many years.
Thank you.
We are joined, thank you. We are joined also by a number of my colleagues, and I will get those momentarily to announce who's here. But let me say DEP's fiscal 22 budget is $1.5 billion, an $81.2 million increase when compared to the fiscal 21 adopted budget, with a large portion of its funding coming from city funds. And in comparison to prior years, the executive budget added more funding to several key programs and initiatives. As the agency responsible for managing the city's water supply, air quality, and hazardous materials pollution, DEP has one of the largest capital construction programs. And despite the tumultuous year we had in 2020, this year's proposed executive capital budget is no exception, with $13.7 billion in proposed capital commitments between fiscal 21 and 2025, with $2.3 billion in fiscal 2021 alone. Notably, across DEP's capital portfolio, of the $1.04 billion being added, $687.9 million was added for water pollution control, $237.8 million for water mains, $117.2 million for sewers, and $5.3 million for water supply. At today's hearing, I look forward to learning more about DEP's proposed executive budget and how it plans to implement some of its new and existing programs and capital projects. Thank you to John Seltzer and to Crillian Francisco from the Finance Division for the preparations for today's hearings. And I also want to thank Stephanie Ruiz, our committee counsel, for all the work that she does to make these hearings possible and for always being on top of everything for me. I'm most grateful to you. Thank you, Stephanie Ruiz. And now I'm going to turn it over to Chair Gennaro for his opening statement. Chair Gennaro.
Thank you, Mr. Chairman. It's a real joy to be here with you. As you said, we've known each other a long time. We've never had the opportunity to chair a hearing together, and it's really great to be with you as always. Thank you for your friendship and brotherhood. I really appreciate that. And good morning, everyone. I'm Jim Gennaro, Chair of the Committee on Environmental Protection. Today we'll be hearing from DEP on their fiscal 2022 budget. DEP's proposed expense budget totals $1.52 billion over the proposed and proposed capital commitment plan totals $13.7 billion over 5 years. I look forward to hearing more about the agency's strategy to fill vacant positions, which are agency-wide, making sure the city is prepared for the Roundout West Branch bypass tunnel shutdown, which is on the horizon, and DEP's capital strategy and timeline to build out sewer infrastructure in Southeast Queens to ease persistent flooding in my home borough of Queens. I'd also like to make a special note to thank the mayor and his administration for not reinstating the rental payment. That was a big crusade of mine back when I was on the council and, chair of this committee. And it's a very, very regressive tax on ratepayers. And I thank the mayor for, rolling back on the rental payment, which many people have forgotten about, but I have not forgotten about it. And but for the elimination of the rental payment, we would not be looking at a 2-point-something% water increase. We would be, 20-something%. And so I have to give credit where credit is due. I like to thank DP Commissioner Sapienza and all of the good people from DEP who will be testifying here today. I look forward to hearing from you, Commissioner, and your good team. I'd like to thank Tamara Swanston of the DEP staff, my own legislative director, Navi Kaur, and I'm just making reference to my phone here. Everyone will give me a chance here because I'm the new guy, just getting settled back in again. They gave me first names. Isn't that great? Okay, so I already thanked Samara. I'm thanking Ricky and Nadia and John for all their good work in getting us to this good point to have this hearing. And my statement says that I'm turning it back to the committee council. How'd I do, Danny? Okay, is that okay?
You did great, Chair Gennaro, as always.
Thank
Great
you.
to have you back in the council too. You're a strong advocate for the environment, and we really benefit. New York City benefits from your presence here. Thank you.
Thank you very much, Danny.
Yeah. I also want to thank Robin Forst, without whom I'd also be lost because she takes care of all the things that I can't get to, and she's been joining us on these hearings ever since they started. So thank you, Robin, as well for all your work.
Oh, and I should probably try to, let's see. Let me go to, I'm just messing with everybody today. Let me go to gallery view and see what members of my committee are here as well. I should give them a shout out. I should look, okay. I see Councilmember Dharma Diaz is here. And I'm looking for others in the EP fold. I would ask Nabby to text me the names of people that I may not be able to see here on the screen. And I'll give a shout out to my good friend Barry Grudenchik, just because I like him. I'm the chair, I can do whatever I want. And so there you have it. And so with that said, we're turning it over to the committee council, right, Mr. Chairman?
Yes, sir.
Okay.
Thank you, chairs. My name is Stephanie Ruiz, and I am counsel to New York City's Committee on Finance. Before we begin, I want to remind everyone that you will be on mute until you are recognized to speak, at which time you'll be unmuted by the Zoom host. If you mute yourself after you've been unmuted, you will need to be unmuted again by the host. Please be aware that there could be a delay in muting and unmuting, so please be patient. During the hearing, if council members would like to ask questions, please use the Zoom raise hand function. You will be called on to speak. We'll be limiting council member questions to 5 minutes, including responses. I will now administer the affirmation to the administration witnesses. Do you affirm that your testimony will be truthful to the best of your knowledge, information, and belief? Commissioner Sapienza.
I do.
Thank you. Deputy Commissioner Michael Deloach.
I do.
Thank you. Deputy Commissioner Angela Licata.
I do.
Thank you. And Chief Financial Officer Joseph Murrin.
I do.
Thank you. Commissioner, you may begin when ready.
Just before Commissioner starts, Council, I don't have the text chain for this hearing. Can you make sure that I get that?
Absolutely.
Okay, thank you. Commissioner, why don't you start, man?
Thank you, and good morning, Chair Drum, Chair Gennaro, members of the Committees on Environmental Protection and Finance, and Chair Gennaro, congratulations again on your election and appointment to the committee, and we look forward to working with you as well. I am Vincent Sapienza.
I appreciate that. Thank you.
Oh, thanks, Jim. I'm Vincent Sapienza, the Commissioner of the New York City Department of Environmental Protection, or DEP, and I'm here to speak about DEP's executive budget for FY22. I have some brief testimony. DEP's mission is to enrich the environment and protect public health for all New Yorkers by providing high-quality drinking water, managing wastewater and stormwater, and reducing air noise and hazardous materials pollution. We provide about 1 billion gallons a day of high-quality drinking water. It's delivered through reservoirs on our watershed through 7,000 miles of tunnels, aqueducts, and water mains. Another 7,500 miles of sewer lines convey the wastewater and stormwater, and we operate 14 wastewater resource recovery facilities around the 5 boroughs. Now in our operations during COVID. As I mentioned when I testified in March, I'm very proud of the work that DEP staff has done in the past year. We've maintained all core services throughout the pandemic without interruption or impact to water quality. Our workforce smoothly adapted to the needs during the pandemic. Most of our staff continually reported to their job sites in the field, though we implemented social distancing, required temperature checks, and provided them with extra personal protective equipment. Office staff worked from home if it was possible to do so, supported by our Bureau of Information Technology. On May 3rd, office staff began returning following CDC and DCAS guidelines to keep everyone safe and healthy. Our staff has also stepped up to support the city's overall effort to fight COVID. Starting last spring, DEP and DOHMH worked together along with outside experts to establish a coronavirus wastewater testing program. The program provided DOHMH with additional pieces of data to alert them to potential outbreaks around the city. Our lab staff also produced more than 17,000 gallons of hand sanitizer for other agencies, for the visiting nurse service, and to distribute to the public in city parks. DEP staff volunteered at the command center to make calls to identify PPE needs and to work in the vaccine hubs. We also made changes to some publicly facing procedures to ensure that we're providing the best customer assistance possible. We implemented a digital permitting system so that business and property owners could apply for necessary permits remotely. We implemented paperless solutions for vendor invoicing and payments. And for construction contracts, sealed bid envelopes are now publicly opened using Microsoft Teams for transparency. Regarding fiscal impacts from COVID, like the rest of the city, DEP has felt financial impacts. Our operating revenues are about $175 million lower than they were this time last year for 2 main reasons. First, water consumption is down about 4.7% as offices and businesses were closed or less active. The second reason is delays in water bill payments. Significantly overdue payments have increased by 26% year over year, with more than 40% belonging to non-residential customers. We know that many residents and business owners have been financially affected, and so our billing assistance teams have been actively working with customers on extended payment plans. And to the council members, if you hear from constituents who are having trouble paying a water bill, please ask them to reach out to us at 718-595-7000, and we'll gladly work with them. Simply ignoring utility bills can unnecessarily blemish credit and cause avoidable late charges. Because we do not know when water consumption and bill payments will return to previous normal levels, we must take a conservative approach to our spending. We continue to speak with our regulators about relief on certain unfunded mandates, but we do not know what the outcomes of those discussions will be. DEP's proposed FY 22 to 31 capital plan is $22.7 billion, of which 26% is for federal and state mandates. We are prioritizing projects to ensure that our funds are allocated where they best serve the public, such as improvements to our wastewater resource recovery facilities, for sewer replacements and extensions, and for water quality preservation initiatives. A little bit about the water rate now. The water and sewer rate had no increase in 3 of the past 5 years, including this current year, fiscal 21. For fiscal 22, the Water Board is considering an increase of 2.76% to cover projected needs. For an average single family, this amounts to a monthly increase of $2.22. As a point of comparison, the average single family in New York City spends 20% less on water and sewer charges than similar residents in other cities across the US. The proposed 2.76% rate increase in FY22 enables a 50% expansion of our customer affordability programs from $20 million per year to $30 million, providing credits for an additional 53,000 billed customers who are in need. The proposed budget has no rental payment to the water system, from the water system to the city's general fund for FY22. So looking forward, COVID has not stopped DEP from moving on with critical work. Capital construction and repairs have continued, including the major Southeast Queens sewer build-out, City Water Tunnel number 3, and the repair of the Delaware Aqueduct. In 2020, we built more than 3,000 new green infrastructure assets in Queens. It's a record number of installations for a calendar year. On Earth Day last month, we launched the Harbor Protector Volunteer Program, which combines our rain garden stewardship program with catch basin cleanup, catch basin stenciling, and shoreline cleanup. The program launched with a kickoff event in Coney Island with staff, volunteers, and children from local schools working together to clean up litter and stencil catch basins. We look forward to continuing our innovative programs and progressing other critical work in partnership with the council. And my team and I are happy to answer any questions that you may have.
Thank you very much, Commissioner. It's good to see you again, too. And this is my final budget hearings for my tenure in the City Council. And I've enjoyed working with you, and particularly with Michael Deloach, who's so responsive to any issues that I've had in the past. So thank you and welcome again. In the executive plan, DEP only received a small portion of federal funding. Can you please break down the sources of this federal funding? Was it stimulus funding or something else? And if it was stimulus funding, how would these funds be used?
Yeah, so Mr. Chair, we do get small amounts of federal funding, but none was from the stimulus program at this point. We continue to look at all sources of funding that may be available, particularly looking at some of the infrastructure funding that's being discussed now, and we think that that may be helpful for the water program. That's where we are at this point.
So you are having some discussions with OMB about capital projects?
As far as the current stimulus funding that has been provided to the city, we know that those are being looked at for other uses than the water system at this point. But again, we continue to work with OMB and with our federal and state partners to find money for the water system.
Okay, thank you. In your testimony, you mentioned the water rate. The Department's Home Water Assistance Program will be expanded by $8 million for a total of $14 million in fiscal 22. The Multifamily Water Assistance Program will also be expanded by up to $2 million for a total of $12 million in fiscal 22. How many households do you anticipate receiving a bill credit in fiscal 22 for these programs?
So, Mr. Chair, we felt it was very important with many residents still struggling to pay their bills to expand our water affordability programs, and so we're going to be providing additional bill credits to those that are in need. The $145 bill credit that goes to recipients will add an additional 45,000 households for a total of 96,000. And for the affordable apartments under the multifamily water assistance program, who will receive a $250 bill credit, we're adding 8,000 affordable units to a total of 48,000. So an additional 20%.
Okay, thank you. Did you see an increase in the delinquency rate for non-payment of water charges in fiscal 2020 or 21? And can you please tell us what the delinquency rates were in each of those years and how they compared to prior years?
Yeah, I'll start and then turn it over to Joseph Murin, who's our Chief Financial Officer. But we have seen an increase in delinquencies, particularly among the non-residential portion of the billing. Obviously, businesses were significantly affected, and so there have been delays in what we consider, significantly delinquent beyond 180 days on the bills. And as I mentioned in my testimony, it's important that those who are having trouble paying bills, please contact us, because just ignoring the bill, you're accruing late charges and fees, you're blemishing your credit to credit rating agencies. So it's important that you get in touch with us, and we have a number of payment programs to extend over as much as 10 years what you owe. So that's important. Joe, do you have the numbers?
I have, as you referenced in the testimony, Commissioner, it's up by 26% over the prior year. And that breaks down, the bulk of that, or I should say a large portion of that is in the commercial and industrial sector. There is still, a large increase as well on the residential, both for the single family and the multifamily home. But we do have a breakdown, which we could share with the chair and the members as well, in terms of where that, those numbers are at.
Interesting, because DOF is also having a problem with the collection of taxes on commercial properties as well. So that it's maybe connected with the water problem, with the water bills as well. I think they've suffered a lot.
And we've also seen, Mr. Chair, a large decrease in the usage in our commercial and industrial and the airports, the entertainment sector. So we think that's indicative, and we've been working closely with OMB using those as indicators for both the impact of the pandemic as well as where the recovery might start happening. We believe a lot of those customers are having economic impact from significantly reduced business that has, while it's maybe they're not using as much water, they also have accrued, those larger balances on their non-payment of bills.
So when you said that you've seen an increase in water usage,
or no, an increase in the delinquencies.
Yes, okay.
A large decrease in water usage.
Right. Okay, a large decrease, right.
Yeah, Mr. Chair, we've seen about a 4.7% decrease in water usage year over year, and that's likely because a lot of businesses and offices have been shut down or slowed.
Mm-hmm. Would that translate then into an increase in residential usage?
Yes.
Yeah, it's interesting. Yeah, it's interesting, Chair John. We have seen on the single-family homes, 1 and 2 family homes, a slight increase in water usage as more folks work from home. We have seen that, but overall, water consumption citywide is down.
Right. And
very interesting.
Sorry, Mr. Chair, but the breakdown was the single family was up about 3%. The multifamilies were down about 1.6%. And the non-residential is down about 18.4%, year over year.
Right. Very, very interesting. Yeah. Unfortunate.
Yes.
Okay. Thank you for that. The Executive Capital Commitment Plan includes $946.3 million to build combined sewer overflow tanks at 2 locations on the Gowanus Canal to reduce sewage outfall in the water body. What is the timeline to fully install these tanks, and what level of combined sewer overflow reduction will be achieved with the tank installation?
Okay, I'll start and then turn it over to Michael Deluxe and Angela Licata. But I think the council is aware that EPA designated the Gowanus Canal as a Superfund site, and as part of their record of decision several years ago, required the city to reduce combined sewer overflows into the canal with the construction of 2 tanks, an 8 million gallon tank and a 4 million gallon tank, which we're well underway with. Obviously, they're large and complicated projects, going to be disruptive to the neighborhood once we start excavating and pouring concrete over the coming years. But properties have been acquired, work is underway, and we anticipate that the work will probably go on through the end of the decade. We're still negotiating dates with EPA, but that's where we are. I don't know if Michael or Angela, you have anything to add?
I don't. I think that's a good summary of where we are.
Okay, thank you. And I'm going to say, so what type of overflow reduction will be achieved with the tank installation?
I don't know if Michael or Angela, you have that. I know it's over 80% on both those outfalls. Do you have those numbers?
Angela, do you want to go into some detail about the new storm rule and sort of the overall?
Sure. Hi, everybody. The 2 tanks are expected to exceed the EPA's requirements in their record of decision. That required a range from 59 to 74% reduction in solids coming from combined sewer overflows. And we aim to be in the 80% or so target. And we also have, for addressing growth, due to and related to the city's proposed rezoning of the Gowanus area, what is known as a unified stormwater rule. So this would address our requirements to control stormwater flow and rate, and would unify that with a new requirement to address water quality issues. So it would target a water quality volume as well. So together, those proposals would address the additional sanitary flows that are expected in the area and end up with a net neutral result to the sewer system.
Hey, thank you, Deputy Commissioner. Let me move on to the Mayor's Cleanup Corps. Mayor de Blasio recently announced the launch of the city's Cleanup Corps, a program aimed to hire 10,000 New Yorkers to make New York City the cleanest, greenest city. With over 100,000 catch basins citywide, has DEP had any discussions with the agencies overseeing this initiative to ensure that catch basin grates are kept clean and that water during rain events flow easily?
Thanks for the question, Chair Drum. And DEP was authorized 254 headcount allocation from that. We've already had staff start within the past couple of weeks, and we intend to build up over the summer. But it's a great opportunity for us to get a lot of work done related to catch basins, hydrants, just making sure that our facilities are more adequately maintained and kept in good state of repair. And it's also a good opportunity for those we hire as we have vacancies for positions, full-time positions at DEP. We think it's a good opportunity for folks to move up into those positions ultimately.
Well, that's fantastic. That's really good news to hear. All right, I was a New York City public school teacher for 25 years before I got elected to the council. So I have to ask an environmental education question. DEP offers educational programming to all age groups and more to the DOE for K-12 education. What are some of the educational programs being offered by DEP? And was this programming impacted by the COVID-19 pandemic?
I'll start and then hand it over to Michael. But we want to make sure that people who pay a water bill and kids as well understand, where their water comes from and how complicated it is to get water to a tap, and then what happens when you flush the toilet, where that water goes and how it's treated. So we've been doing many programs over the years, and Michael, you can expand on that.
Yeah, we're incredibly proud of our education team who always does good work, but during the pandemic really went above and beyond, ensuring that we had virtual learning and that we had digital resources, online tours to walk through people, the process of what DEP does. We also did a new climate change education module, which is in coordination with DOE, which is some really new pertinent information about the risks of climate change. So yeah, we think we reached about 40,000 people in a usual year, and I think with everything we've done to be more nimble and digital, I think we reached more teachers, more students. So we're also looking forward to getting back to being outside and doing. We have trout in the classroom. We have lots of activities at the visitor center in Newtown Creek. So we're excited to get back to more outdoor programming, but we've definitely adjusted in ways that are going to be beneficial moving forward, even regardless of the pandemic, to give more educational tools to teachers and to students. So
yeah, thank you. I always find it fascinating, and I think kids would too, to find out how New York City gets its water.
Absolutely.
And from all the way upstate and places like that. But anyway, I'm going to turn it over to Chair Gennaro. But before I do, let me just check to make sure that everybody has been announced. We have council members Adams, Barron, Lewis, Darma Diaz, Powers, Grodenchik, Ampry Samuel, Ulrich, Koslowitz, Minora Lita Matteo, and Councilmember Van Bramer. And I hope that I've gotten everyone, but I think that I did. So let's go over to Chair Gennaro.
Thank you, Mr. Chairman. I appreciate that, and thank you, thank you, Vinny, for your good answers to the chairman's questions and all of your staff. It's a pleasure to see Angela Licata, with whom I know have had a long working relationship when I was at the council, and then when I was over at DEC. It's a pleasure to be with you. This is a question for the commissioner. In review of DEP's fiscal 2022 budget, I noticed that DEP has a number of vacancies agency-wide. As it stands now, the current fiscal year, the budgeted headcount is 6,258 positions, while the actual number of filled positions is 5,679, leaving over 579 vacancies. Let me just follow up with that. It appears that with regard to green infrastructure, they seem to be, according to the staff analysis, the most difficult to fill, with only 96 of the 210 positions filled to date. And follow up to that, it appears that engineering, design, and construction jobs are also have a lot of vacancies, with only 353 of 423 positions filled to date. And as we move forward to fiscal 2022, what is DEP's strategy to make sure that the budgeted headcount needs are filled in a more timely manner?
Mr. Chair, thanks for the question. The hiring slowdown over the past year has resulted in a larger number of vacancies as people left city service. We've done a number of things in the past months to work with OMB now that the fiscal situation has stabilized with some of the funding that we've gotten citywide. So I'll speak first about the green infrastructure program. So many of those hires there are to maintain our rain gardens, bioswales, and those are seasonal hires. So we will ramp those up rather quickly to get all those filled. You mentioned engineering, design, and construction. It's been, it's typically a challenge to hire and retain engineering talent for the city. We've had a number of retirements at the Bureau of Engineering, Design, and Construction. But again, as the hiring slowdown and freeze opens up, we expect to, call some civil service lists and hire there.
Thank you. Thank you. I'm going to go off my question list for a second just to follow up on something you said about DEP's very comprehensive COVID response and all the ways that DEP stepped up to make a positive difference in the COVID crisis. I want to thank you and all of your staff for doing that. That's certainly more of a comment than a question. I just want to pay tribute to DEP's good work in that regard. I remember way back when I passed the stormwater management plan and that became law. And a big part of DEP's stormwater management methodology has been to build the rain gardens. I have many of them around my district that are either finished or in the state of being constructed. And do we have any estimate on the on what kind of CSO reductions will be realized by virtue of the deployment of all of these rain gardens? Because people come to me and they say, like, what are these rain gardens really going to do? It's just a small area, and of course I tell them that it was my legislation that led to these things built in the first place, which of course they're very appreciative of, and I say that jokingly because not so much. But I like to be able to give them an informed response on the value added to local water quality from the installation of the rain gardens.
You're right, Mr. Chair. This goes back, to your previous tenure. And just as a little bit of a background, in New York City, it's mostly paved. So when it rains, water just runs off, goes into the sewer system, and the sewers can be overwhelmed and release excess water into local waterways. That's called combined sewer overflows. There's almost so much we can do as far as hard, what we call gray infrastructure.
Yeah.
Those are tanks and bigger sewers. So we started at the time looking at keeping stormwater runoff out of the sewer system by building rain gardens, and these are these
Right.
curbside devices that store runoff that otherwise would go in a catch basin and into the sewer system. And I think we have about almost 11,000 now either built or in construction currently. And Angela, do you have numbers on reductions in combined sewer overflow?
Yes, Commissioner, and absolutely wonderful program. Thank you for your leadership, and thank you for your trust in our innovation here. We expect that these 11,000 assets that are either constructed or in construction will result in over 1,500 gallons of combined sewer overflow reduction. And we have targeted these assets within those priority water bodies where we are struggling to meet water quality standards for a variety of reasons. There are many impairments in those water bodies, and CSOs is one of those impairments.
But when you speak of reduction of 1,500 gallons, I think you said, is that 1,500 gallons over what period of time, or is that per asset, or?
Thank you for correcting me.
Yeah.
I'm actually really sorry. Yes, it's about 500 million gallons of reduction, and it's about 1,500 greened acres.
Oh, okay, great.
Even catch that. Yes. So a greened acre is, we measure that with 1 inch of rainfall over an acre of property. So
Right.
that's how we calculate that. Based on those 1,500 greened acres, we will achieve about 507 million gallons of reduction in combined sewer overflow per year.
Great. Okay, that kind of frames it out a little better. Thank you for that, Deputy Commissioner. Feels funny to call you Deputy Commissioner. I always call you Angela. So, anyways, I have a question for the Commissioner regarding biosolid treatment and disposal. Of course, we're all aware that a core function or agency that he must process, export, and dispose of biosolid material. However, I believe, well, I don't like the wording of this question. Let me reword it. To what extent are we trying to achieve more beneficial reuse of the biosolids rather than disposal? And I say that with a knowledge that sometimes that the biosolid material has been contaminated by heavy metals, which is just, is what it is. And if you have something that is contaminated, it is sometimes very hard to beneficially reuse it. So to what extent are we kind of forced to simply dispose of it rather than beneficially reuse it? And is there some sort of pathway to how we can more beneficially reuse this material, or is the cost of doing that prohibitive?
It's certainly our goal, Mr. Chair, to continue to push the beneficial reuse. And we generate about 1,300 tons per day of this organic material that gets removed from the wastewater treatment plants. Going back, I'm going to say to 2008 or 9, the cost of landfilling that material was so much cheaper than beneficially using it, because the beneficial use requires another step in the process. And just to try to keep water rates in check, going back from 2009, 10, and 11, we essentially did 100% landfilling. Over the last few years, though, we've tried to make a better effort to beneficially use. And we're actually up to now about 31% of that material being beneficially used, 69% still going to landfill. But the goal over time is to continue to do more and more beneficial use.
But it would be fair to say that, some that there is some contamination of this material which precludes its beneficial reuse. And when you make reference to an additional step, it's probably a step that would remove some of the harmful contaminants. Is that fair to say?
Yeah, and it's mostly what they call pathogen reduction, Mr. Chair. At this point, that's what we need to do. So doing things like composting, lime stabilization, digesting for more time does that. I have the cost, by the way. I want to give you that too. For landfilling, we're now paying $122 per ton. Beneficial use is $139 per ton. So that extra processing is
Right.
about $17 per ton.
Okay, well, we will continue to track that, and I certainly applaud your efforts to maximize beneficial reuse, within prudent fiscal boundaries. So thank you for that. Another question about or my next question will be about the Roundout West Branch Tunnel. Roundout West Branch Tunnel conveys Delaware water supply across the Hudson River towards the city as a critical component to the water supply system, delivering more than 50% the city's drinking water annually. This is kind of a history of a problem. The leak was first detected in 1991. I will remember that. I was on staff at the council at the time, and it's expected that the leak rate is about 15 to 35 million gallons per day. That's been long known. So we had to build the bypass, and okay, let me finally get to the question. When does DEP anticipate connecting the bypass tunnel? I know we had a previous conversation where we talked about this a little bit, and about the preparations for the shutdown, how long that will be, and if you could walk us through how we will operate during that shutdown, so that we can make sure that all New Yorkers have an adequate supply of clean water during the bypass period. And how long will the shutdown be in place? You get the general idea.
I do, yeah. This is the largest water supply repair program that New York City has ever undertaken. So the Delaware Aqueduct, which conveys about 50% of the water used by the city of New York, has been leaking for quite a while in the section of pipe that's directly under the Hudson River, about 600 feet below the Hudson River. To make the repair, we just can't take the aqueduct out of service and get in there and spend a year repairing it. So the solution was to build a parallel tunnel, which is now built 2.5 miles long up by Newburgh. And next year in 2022, likely October, we will be connecting that parallel section of new pipe to the existing old pipe that's leaking. And that we expect to take about 5 months. So during the winter of 2022 into 2023, the Delaware Aqueduct will be offline for that repair project. But we do anticipate that we will have sufficient water from our Catskill system and from our Croton system to make up the difference during that period.
Great. And I'll just add to anyone listening, there are some people that may be concerned about the water quality that would come from the now offline Southeast Queens wells, and it is DEP's plan, as I understand it, that in order to supplement the city's water supply during the during that period when the Croton is off, well, when the Delaware Aqueduct is offline, DEP will not have to rely on any water from the Southeast Queens wells. Is that a fair statement?
That's a fair statement. So we've looked at the needs of New Yorkers, and we use about 1 billion gallons of water a day. The Catskill system and the Croton system can achieve that without us having to activate the Queens wells. We had considered it at one point, but it's not needed as far as we know right now.
Great. Thank you, Commissioner. Next question. The capital commitment plan includes $610 million to complete the Brooklyn Queens leg of the city water tunnel number 3. The 2 new shafts will be constructed. Equipment in the existing shafts will be rehabbed. Tunnel corrosion will be addressed, and the new electrical, telecommunications, and security systems will be installed. City water number 3 is important to ensure that we have redundancy in the system and a backup for tunnels number 1 and number 2. Many people know all this. So here comes the question: when can we expect water tunnel number 3 projects to be fully completed and the system 100% online? It's my own recollection that this was a project that was first conceived of in 1954. I'm doing this from memory, 1954. and I believe started in 1971. Is that right? Does that sound right?
That's right.
Okay.
Yeah.
So this is the 50th anniversary of us putting shovels in the dirt and making this happen.
Yeah.
So,
Yeah.
but again, here we are 50 years in. How close are we? When are we gonna have all have the total build out of tunnel number 3 fully realized?
Yeah, Mr. Chair, you're right. It goes back 50 years, and it's been built in sections. City Water Tunnel number 3. The Bronx portion went into service in 1998. The Manhattan leg of the tunnel went into service in 2013, and we're now completing the Brooklyn Queens leg of the tunnel. It's a 10.5-mile section of tunnel that will serve Brooklyn and Queens. 6 of the 8 shafts that bring water from 700 or 800 feet below ground to the surface have been completed. We have 2 final shafts to go, 17B and 18B. Construction contractor is mobilized now. It's the company named Walsh that's going to be doing this work to build the 2 last shafts. You spoke about redundancy, and you're right. Tunnel 1 and Tunnel 2 are decades old, and that's why we're building Tunnel 3. But as I mentioned, the tunnel itself, that deep tunnel, has been in service in the Bronx, in Manhattan, and there's actually fresh water flowing through it in the Brooklyn Queens section that's already constructed. So we feel that we have a good level of redundancy at this point. But as we move forward, constructing those 2 last shafts, there's other work, as you said, that needs to be done and tested. We anticipate that sometime around the end of the decade, we will then take tunnel number 1 out of service to do maintenance and repair there and have tunnel 3 fully in service.
Okay, but in terms of when when tunnel number 3, all remaining shafts are fully built out, we're talking another 10 years or something, or how much?
Yeah, we think less than that. We've spoken to the construction contractor, and as he said, until I start drilling through the bedrock and going down, 700-800 feet, I'm not going to know for sure. But we have estimates that it will take less than that.
Thank you, Commissioner. And this is something we talked about previously. I mean, we're doing redundancy with regard to tunnel number 3, and of course we need that. There are sections of the city that don't quite yet have a full build out with regard to storm sewers. And I'm talking, of course, about Southeast Queens. Here's the question with a narrative and then a question. Flooding in Southeast Queens has been a persistent issue for many years. And, the residents of Southeast Queens, have to deal with these street flooding issues and home flooding issues. I know that DEP has been working assiduously to try to get plans for the Southeast Queens sewer build out with respect to the executive capital commitment plan, a 10-year capital strategy. What is currently, now let me change this question. When can people of Southeast Queens reasonably assume that what is on the drawing board now, and from our last conversation, I know that the full plan right out to the last catch basin, already exists, so we're no longer drawing it on paper. But when can we expect for the Southeast Queens sewer build out, that is storm sewer build out, to be fully constructed and in place?
Yeah, Mr. Chair, as you know, the residents of Southeast Queens have been long suffering since the area was developed, and natural streams that had drained that area were filled in by unscrupulous real estate developers. It's been a challenge, and until Mayor de Blasio in 2015 announced a $1.5 billion program, a commitment to the residents there to build out the sewer system, that was the real first large amount of funding that went towards that. And we've been making incremental progress. So we've been working with DDC. We've completed already a number of projects that have helped residents in some areas. We will continue on with that funding. The pot of money, Joe Murin, I think, is now over $1.7 billion, but we will continue that work until it's completed.
Thank you, Commissioner. Certainly this, I know that I think I speak for all of the members from Southeast Queens, and also for Chair Drum, also from Queens. Councilmember Adams, I saw was is part of this hearing as well. And so we would urge DEP with all due dispatch to seek to allocate appropriate funding, and of course building these sewers does cause some dislocation in the community, but this is something that I see as I begin my tenure as chair of the committee, once again to try to work with my colleagues in Southeast Queens and with your good people to move this on. Also with the next administration, I'll be pushing for as much funding as we can possibly have to make this work as quickly as possible. And with that, that is all of the questions that I had. And so now what am I supposed to do? Mr. Chairman, so
we're going to go back to council, who has a list of council members who want to ask questions.
Oh, so now Danny, are you going out of your way to make my job easy today? If so, I greatly appreciate that.
Well, I'll tell you, Zoom has been great now that we've learned it.
Right. Okay. And you've been doing it for so long, and this is my first thing. People are texting me who's on, who's not, or whatever. And so I leave it in the able hands of the committee council to recognize other members for their good questions. Thank you, Mr. Chairman.
Yes, sir.
And thank you, Vinny, and your great team. I of course reserve the right to come back and ask more questions.
Of course.
Okay, you bet.
Of course.
Thank you.
Okay.
Thank you. If any council member has questions for DEP, please use the Zoom raise hand function. You'll be added to the queue. Council members, please keep your questions to 5 minutes, including answers. Please wait for the sergeant at arms to tell you when your time begins. The sergeant will then let you know when your time is up. We will now hear from Councilmember Adams.
Time starts now.
Good morning. Thank you so much to our chairs, Chair Drum, Chair Gennaro. It is just a delight to hear you officiating this hearing this morning. You have brought a lot of joy to my heart today. So I'm so happy to have you as chair on environmental protection. You just don't know. Your expertise is invaluable to the council. So thank you. And thank you also for highlighting in your questioning the issues of Southeast Queens. We've been through a lot. Commissioner Sapienza, we've been through so much, haven't we? A lot. For sure. We've been through a lot of pain, but you have been there with us from day one. Just hanging tough with us through thick and thin, literally. Michael Deloach, can't thank you enough for your help as well during the extensive, and it's still going on, the extensive issues around the South Ozone Park sewer emergency that happened 2 years ago. My constituents are still suffering very greatly. I can't believe it, but they're still suffering very, very greatly because of that emergency, that disaster, which it's turned out to be. And I'm in touch with them multiple times during the week, actually, ongoing. So I guess, I don't really have anything prepared, but it's such a sensitive issue for me, still literally being in the trenches around this issue. I guess, Commissioner, I just hear from my constituents that subsequent to the sewer emergency, there have been issues of flooding that haven't existed before. So I don't know if you're aware of it. I'm going to assume you are. Can you just give me a little bit of insight and explanation as to why that's happening, why my constituents are still suffering with flooding? Even though the construction that's going on, we know in the long run, that's going to be, the best thing for us. But why are they still suffering with issues of flooding today?
Yeah, thanks, council member, and thanks for all your amazing work for months and months being out there and supporting us all. It was, a terrible situation, obviously, for more than 100 property owners there, the homeowners still suffering, as you said. What we've done is to date, and I'll talk about the flooding in a minute, is replace about a half-mile section of sewer that was built by New York State DOT when they did the Nassau Expressway job. And we just determined that that whole section of sewer just wasn't able to be rehabilitated. It was just of such poor quality. So we built a new section, a half-mile long of new sewer to do that. The storm sewer program that Chair Gennaro talked about is also proceeding, and that will help. Stormwater flooding is still a challenge for South Ozone Park. I won't deny that during heavy rains. There's plenty of street ponding and flooding, but as we move forward in time and get these additional projects done, that will certainly help.
I appreciate that. We've got a long way to go. My constituents are still pumping water, and, my heart goes out to them. I've been, in a whole lot of different settings with them, in the homes and press conferences and meetings. And like I said, this is ongoing. So I'm also going to throw out there before my time is up, and I don't know if you can respond to this, it may be somewhere else, but we've had numerous complaints about the boiler installations that have gone on and the fact that some of these boilers are faulty. We don't know if they've passed code. We know that there have been noises, there have been fumes, and my constituents, it's just so much that's gone on, as a backlash because of this horrible emergency. So now we're looking at equipment that was installed that's possibly faulty, that we're not, up to code as it should be. So we don't know if it's just, give them the leftovers, whether or not this equipment was used. We don't know where this equipment came from, but those are the facts. So among a whole lot of other facts. So I'll just put that there. I don't know if you have anything to say. I'm going to request Chair Gennaro's ongoing advocacy with us in Southeast Queens on resolving all of these issues. We've got issues of black mold, which we knew were going to happen, and nobody really wanted to listen to the long term. It's 2 years later, and now we have people being sick because of black mold because of that situation as well. It's just, multiple situations going on over there. But can you address the boiler issue at all?
Sure, and I'll be brief and then turn it over to Michael Deloach, who's been really on top of this. So we've gotten complaints from some of the homeowners who received new boilers, and we provided new boilers and hot water heaters to those who had basements flooded. We've gotten complaints about from the homeowners and the plumbing community about some issues related to the boilers, and we've been working with the Department of Buildings on that. And Michael, you can take over from here.
Yeah. Hi, Councilmember. I've been working closely with Ms. Cook, who's keeping good track of all the issues that residents are having. I just want to be clear from the beginning, though, that all of the equipment that was installed was confirmed brand new through DEP, working with the contractor that we had, and everything was done to code with all the DOB permitting that we kept track of. So just to make sure that we're clear, it is new infrastructure and it was to code. There are some existing issues with things not related to the direct installation of a new boiler or hot water heater that we didn't necessarily do that is having some issues, but we are definitely working through. I know there's a handful that we're talking to Ms. Cook constantly with about to help resolve, but I just wanted to make clear, because I was out there firsthand and saw it all happening and was working all the homeowners. I just want to be clear, it was to code and it was new. That doesn't mean that there aren't some issues that we're still working to resolve, but we're definitely working as much as we can, appreciating that this has gone on for too long and trying to do what we can to make it right for the property owners out there.
I appreciate that, Michael. And again, thank you for being on top of this. We know that Ms. Cook is our champion out there.
For sure.
Yes, for sure. So we thank her publicly as well for all of her hard work. It has not been easy at all for her. So I appreciate your partnership ongoing, and Commissioner, of course, your steadfast dedication to a solution to these problems that are just excruciating for my constituents. And Chair Gennaro, for your ongoing advocacy and partnership in helping us to get solutions to these issues in Southeast Queens. Thank you so much for your testimony. Thank you.
I'm going to just jump in here for a second, make a note to staff, to the Council of the Committee, Samara Swanson, and to my legislative director, Nabi Kaur, to follow up with Councilmember Adams. You know, she made a note about working with us to follow up on the mold issues and some of the other issues that she's addressed. And so I'd ask staff to put that in motion with Councilmember Adams. I want to be part of that. And so, thank you for, asking us to work with you, Councilmember Adams, and we'll get that scheduled and we'll work with you on that. So thank you.
Yes, and may I add, those residents are so lucky to have you, Councilmember Adams, out there fighting for them and making sure that their situation, which, I heard of at a hearing, I believe it was last year, which was so terrible. And hopefully, as I hear you now, that's being corrected. So I can't imagine having a home, paying a mortgage, and yet finding yourself homeless, which was the case for many of those residents. So it's good to hear the DEP is working with you on that. Thank you. I think that's it for questions. And we're going to have Health and Hospitals is here, I believe. Yes, I see Dr. Katz is here. So we're going to move right into that section. If that's all right with council, I have a statement to read. Council, we're okay? No other questions?
No.
I'll just take this opportunity if we're finished with DEP to thank the commissioner and his great team and for their testimony today, for all of their work leading up to today, and thanking them in advance for their ongoing partnership as we move through the budget and protect the environment and water delivery of New York City.
Thank you. Same here. Thank you, Chair Gennaro. At this point, this will conclude this portion of today's hearing. Thank you to the Department of Environmental Protection for being here. We will now move on to Health and Hospitals. I ask my colleagues who will be joining us for this portion of the hearing to remain in this Zoom with your microphone muted until we are ready to begin. Again, thank you very much.
Thank you, Mr. Chair.
Good morning, Dr. Katz. Can we give you audio check right quick, please?
Good morning.
Good morning. You're coming in loud and clear. Thank you.
Thank you.
Okay. Good morning, Dr. Yang. Can we do audio check, please? Okay, while we wait for Dr. Yang, Chrissy Flannery, can we do audio check, please?
Good morning.
Good morning. You're coming in loud and clear. Thank you.
Thank you.
You're welcome. Councilmember Rivera, can we do audio check, please?
Good morning, everyone.
Good morning. You're coming in loud and clear. Thank you. Good morning, John Burke, Senior Vice President. Can we do audio check, please?
Good morning.
Good morning. Coming in loud and clear. Thank you. Okay, good morning, Chair Rivera. Are you ready to start? Okay, thank you. Okay, Chair Drum, are we ready to go?
Yes, I'm ready.
Okay, great, thank you.
Okay. Good afternoon and welcome to the City Council's 8th day of hearings on the Mayor's executive budget for fiscal 2022. My name is Daniel Drum and I chair the Finance Committee. We just heard from the Department of Environmental Protection and we will now hear from New York City Health and Hospitals. We are joined by the Committee on Hospitals, chaired by my colleague, Councilmember Carlina Rivera, and we are also joined by the following council members: Adams, Anthony Samuel, Barron, Brooks Powers, Dharma Diaz, Grodenchik, Koslowitz, Levin, Lewis, Mizell, and Moyer. In the interest of time, I will forego an opening statement, but I'd like to turn it over to Chair Rivera for her statement.
Thank you so much. It's my favorite time of year. I get to preside with the inimitable Danny Drum. Thank you, Chair Drum, for everything. I'm Councilwoman Carlina Rivera, Chair of the Committee on Hospitals at the New York City Council. During today's hearing, we will review the New York City Health and Hospitals $980 million fiscal 2022 executive budget operating subsidy, of which $619 million is city funding. This week marks the beginning of the easing of social distancing restrictions for COVID-19, and we are beginning to see a resemblance of normality return. We are on the precipice of tremendous change, and as we look back on the devastation of the past 15 months, we can clearly see the important role public health and our public hospital system played. The next steps we take will be key to New York City's future. Gone are the days where we can cut funding to health. Instead, we must arm ourselves for the future and the next health crises and systemic inequities already present in our system. Thankfully, the federal government has invested billions of dollars to combat the pandemic, including many dollars that have made their way to H&H. However, New York State's fiscal 2022 enacted budget includes close to $90 million in budget cuts to H&H. The state must reverse these troubling cuts in next year's legislative session, and our city needs to commit to putting more funding in H&H for the future, particularly to ensure that any new or old initiatives funded through one-time federal investments are not suddenly eliminated. We cannot be caught unguarded ever again, and funding needs to be available every year in preparation for any healthcare risk. And though New York City is in a much better place, having reached the lowest rate of positivity in the last 6 months, there are still New Yorkers getting sick from COVID-19 every day. The number of people vaccinated must increase significantly. H&H must continue to reach people where they are with mobile vaccination sites and door-to-door vaccination efforts. The distribution of vaccines is still not equitable, and while I appreciate the city's commitment of $9 million to community-based organizations to do further vaccine outreach, it's troubling that it took so long to get this money out the door. and that it's coming from DOH-MH, not T2, which has led COVID outreach efforts since the beginning of the pandemic. Outreach has never been more important, and it must be improved, particularly in all languages and media types. And for those who still get infected, H&H will continue to provide support in helping them stay isolated and find the health supports they need. I look forward to seeing how the COVID Centers of Excellence support long haulers. We also need to make an investment into the future of primary care. It has never been clearer how necessary it is to reduce the rates of chronic illnesses, such as asthma and diabetes, that disproportionately affect people of color in our city. We've known for a long time how these diseases can impact the daily lives of people, but the pandemic emphasized how much of a greater risk people with chronic illnesses face. And as we move forward, H&H is going to play a vital role in ensuring New Yorkers receive primary care and are able to prevent or halt the development of chronic illnesses before they become high risk. It has never been more important for New York to commit financially to the well-being of New Yorkers. And finally, COVID-19 has made us critically examine the role our public hospital system plays in the overall framework of public health initiatives. In just the last few years, we've seen new programs from H&H, like the T2 initiative, which continues to draw both praise and debate from advocates, New York City Care, which has helped countless New Yorkers gain health insurance, and other fantastic initiatives like investments in cure violence programs and EMS responses to New Yorkers struggling with mental health crises. It's clear that H&H is at a crossroads when we think about where their services end and begin. Is it at the door of a hospital or the door of someone struggling in our community? I look forward to discussing that future today. And finally, I would like to thank the administration for providing the backup documents for H&H's budget to council in a timely manner. This has been an issue we've discussed throughout my term, and I do want to acknowledge your efforts to assist us in providing the public with the level of transparency our citizens deserve. I'd also like to thank all representatives from Health and Hospital for their consistent hard work and dedication. I look forward to our discussion today about Health and Hospital's budget and the role in the recovery and future of health in New York. Thank you, and I will now turn it back over to the chair.
Was I muted? Thank you, Chair Rivera. Thank you for your kind words, and I do also love working with you. It's a pleasure. Thank you. We'll next hear from H&H. We are joined by Dr. Mitchell Katz, President and Chief Executive Officer of New York City Health and Hospitals, who is joined by several colleagues. Before H&H begins their testimony, I'm going to turn it over to our committee counsel to go over some procedural items and to swear in the witnesses. Counsel?
Yes, Chair. My name is Stephanie Ruiz, and I am counsel to New York City's Council's Committee on Finance. Before we begin, I want to remind everyone that you will be on mute until you are recognized to speak, at which time you'll be unmuted by the Zoom host. If you mute yourself after you've been unmuted, you'll need to be unmuted again by the host. Please be aware that there could be a delay in muting and unmuting, so please be patient. During the hearing, if council members would like to ask questions, please use the Zoom raise hand function. You'll be called on to speak. We'll be limiting council member questions to 5 minutes, including responses. I will now mention the affirmation to witnesses. Do you affirm that your testimony will be truthful to the best of your knowledge, information, and belief? Dr. Katz?
I do.
Thank you. Mr. Aldberg?
I do.
Thank you. Dr. McDonald? Just give us a moment to unmute.
You got it.
Dr. McDonald?
Yes, I do. And I'd also like to note that Dr. Yang is present as well, Dr. Patsy Yang.
So I do as well.
Thank you, Dr. Yang. And Ms. Flattery?
I do.
Thank you. Dr. Katz, you may begin when ready.
And just before you begin, Dr. Katz, I just want to say thank you very, very much to you and to everyone at H&H for the tremendous work that you have done over the last year. I don't know how you were able to keep up with it and accomplish everything that you did. I spoke highly of you at the beginning of the week at Elmhurst Hospital, and I am particularly grateful for your personal touch, for your outreach, for the phone conferences that you gave us, for the placement of folks in hotels so they can convalesce. And I just wanted to say thank you to you, to all of the doctors, all of the administrative staff, the nurses, everybody at H&H for the job that you've done over the last year. Thank you very much, Dr. Katz.
Thank you, Chair Drum, and thank you, Chair Rivera, and to all the members of the Committee on Finance and Hospitals. It's truly an honor to work for all of you. It's truly an honor to lead the amazing women and men of health and hospitals, who I do think, as you've said, Chair, have done such an amazing job through this incredible year, both in healing people and holding people's hands as they sadly passed away, of bolstering their colleagues when people felt low. People came in, even though they were fearful of taking home the virus to their families, getting sick themselves. Many people got sick themselves, but everybody stood up. That's what I really noticed, that people came, they did their job. When there was a shortage of oxygen in places in India, I was remembering how my amazing facilities person who's on this call, Christine Flaherty, had figured out at a moment when we too looked like we were not going to have enough oxygen in one of our hospitals. She figured out how, as an engineer, to cool the oxygen tanks so that the oxygen would keep flowing. And that was the kind of thing, everybody came in at 11 o'clock on Saturday night or 2 a.m. on Sunday and did whatever needed to be done. So thank you for the privilege of being here. This is a finance report, so I'm going to mostly talk about finance, and I'll know that you'll raise program issues as you want to talk about them. Bottom line is we're going to close fiscal 21 year with $734 million, which is a very healthy balance for us to close the year. We've achieved 1% above budget variance by $65 million. We've brought in insurance revenue $331 million higher in Q3 fiscal year 20, which matches the health insurance revenue that we brought in $500 million above in the prior year. And I just want to take a minute and say, I know 3.5 years ago, when this Brooklyn boy who had mistakenly been in California for 25 years returned home and said, gee, I think there's a huge revenue opportunity here. People thought I was crazy, that I wasn't prepared necessarily to make the hard decisions, that I didn't understand, the constraints. But we've proven, no, we can. We're not interested in billing patients. We're interested in billing insurance when people have insurance. We're interested in doing all of the parts, the coding, making sure that our diagnostic codes match billing codes, making sure that our contracts pay us fair rates from insurers so that we're not giving them a free ride because we don't know how to do our business. And it's proven that, yes, in fact, we can make a huge difference. And so I know you'll want to talk more with my terrific CFO, John Olberg, who's on the call, about what we've done. But I think it has been financially a very great success story. Chair Rivera was kind to mention our efforts around vaccines. We're very proud of the role we've played of vaccinating people in all the hospitals and all of our clinics. We're proud of the T2. I know it was a bumpy start, but it became we believe, the most successful and largest test and trace efforts anywhere in the US, and had better metrics. And we were one of the few places to show metrics. And we did it with our sister agency, the Department of Health and Mental Hygiene, with whom we enjoy working with, and we will continue, I think, in the coming years to deepen that connection. We've had a recent success with our show vans, which we're very proud of. We have vans that are now going out and vaccinating homeless individuals, also providing them dressing changes and other medical care. And it's been exceedingly successful. And it fits a really nice niche. And I go to Chair Rivera's narrative about where health and hospitals begins and ends. We know that there are people who need us who don't come to the hospital. But of course, I can tell you as a practicing physician, it is challenging to take care of people in a train station or on a sidewalk because you have no privacy. So how can you begin to either ask people or undress their wounds? And we think that these vans are a really good compromise because we can park the van where there are places with a lot of people who are homeless or poorly housed, and then we can bring them into the van. We offer snacks and water, and then we have a private place. And we found it very successful for vaccination, very successful for giving people Narcan kits in case of overdose. And we think that we can keep to grow this initiative and that it has a really nice niche for our city. So we're very proud of that. I have to mention there are always financial risks going forward. Probably the largest is there is a complicated practice for getting reimbursed by FEMA. And we have spent out of pocket $1.7 billion on the COVID response that we believe is all reimbursable under FEMA. And our President Biden had made the reimbursement 100%. However, the process of getting those bills paid is not simple and it is not quick. We were the first out in terms of putting in our receipts to the federal government, but payment has been very slow. So we continue to have watch the cash flow very carefully. We believe we will get the dollars, but I think of all of our financial risks going forward, that's the best. So in closing, to you, Chair Drum, to you, Chair Rivera, to all your great council members, I just want to say thank you for maintaining a public system long before I got here, when a lot of cities did not. And I hope very much that the horrible experience of COVID at least showed people how valuable your decision was in maintaining a public hospital system when other cities did not. Thank you so much, Chair.
Thank you, Dr. Katz. I really appreciate your testimony. I want to start off by asking you some questions about my favorite H&H hospital, which is Elmhurst. Obviously, I represent them, so let's start with the one right there in my district. According to the CDC's website, the first and second round of payments of the Provider Relief Fund COVID-19 High Impact Grant have been issued, but Elmhurst Hospital did not receive a second round of payments. Given the role Elmhurst played in responding to the pandemic, why didn't the hospital receive a second round of payments? And was H&H able to secure funding to make up for the lack of the funds?
I'm going to turn to John Olberg to give a more detailed answer than I can do on the dollars. John?
Yes, good afternoon, good morning. Let me just explain a little bit, leaving where Dr. Katz kind of just explained our overall financial situation as it relates to the COVID response. As he had mentioned, we spent about $1.7 billion. That's our estimate, right? We'll spend $1.7 billion. It could reach as high as $2 billion. And the relief that we've gotten thus far is $1.2 billion from PRF, Provider Relief Fund, and we're grateful for that. And we've only been able to secure roughly $260 million from FEMA. That leaves a gap, right? And this gap is really what has us most concerned. We need to get the difference between the $1.7 billion and the roughly 1.4 billion that we've received thus far. The way that we treat the PRF dollars is that we aggregate that within the system, and then we spend those dollars based on where we see the need. I'll also say is that there's a small amount left. I mean, small, somewhere in the neighborhood of 20 billion out of the total amount allocated by Congress, to the Provider Relief Fund, and we're advocating for some of those dollars to come to ourselves as a safety net and other safety nets across the country. So I hope that explains your question.
We will keep Elmhurst fully funded, I think is the punchline here, as all our hospitals. But it is true, Elmhurst was the center of the center of the center of the pandemic, and I will still, for the rest of my life, remember when Israel Roca, the then CEO, called me up. It was about 11 o'clock at night and said, in the last 2 hours, we've intubated 16 people. This has never happened before. This is like something we have never seen. So we recognize their courageousness, and we will make sure they are fully funded.
Thank you, Dr. Katz. I was not inside the hospital, but I was outside the hospital, as I mentioned to you the other day. And just to see those lines and lines of people outside Elmhurst Hospital, I mean, every single one of them did get care, thank goodness. But we really were the epicenter of the epicenter there. And I see that Councilmember Moya is on the Zoom call here as well. And, our community has suffered from health disparities for a very long period of time. So I'm glad to hear that you're making that commitment to fully fund Elmhurst Hospital. And let me just ask about, should another pandemic or should something happen in the future, are we prepared for that, especially at a place like Elmhurst?
We've learned, Chair, so much about preparation on a level that never happened. When COVID first started, as having been an AIDS doctor, one of my first thoughts was, I've already lived through my first pandemic, and yet this was like 10 times faster, harsher in terms of the number of deaths over a short time. And so, sadly, it has brought us much more prepared. Now for every single hospital, we know exactly how we would expand services. We have 6-month caches of service of supplies. Christine has fixed it so that air handling is better in all our facilities, and we can see into rooms. And we've done a lot of renovation and improvements. So, but boy, let's try to live the rest of our life, Chairs, without seeing another pandemic. I think we've done our share.
Yes, I've lived through the AIDS one as well, and you're absolutely right. Just in terms of Elmhurst again, there was supposed to be an emergency room expansion, which I don't believe has started yet, and also the psychiatric unit renovation. The psychiatric unit on the first floor, not on the upper floor, the emergency psychiatric unit. Do you know where that stands and the timeline for those projects are?
Yeah, I'm going to ask Christine so she can give a much more detailed explanation than I could.
Hi, can you hear me? Good morning, still morning. So the Elmhurst ED addition, as can be expected, was absolutely impacted by the COVID pandemic. And so we currently, the CONs had gone to the state prior to COVID. Actually, I know Chair Drum and many others from Queens came to that on the rooftop event, and I was actually present for that, and that was a big celebratory moment. Unfortunately, we still are in the back and forth from a regulatory perspective on getting the final designs fully approved before we could take that project out to bid. And that does impact the other area on the first floor as well. We also are working with our new CEO, and we will be issuing shortly a RFP for master planning for Elmhurst Hospital. This is a campus that is very landlocked, and we want to ensure that any additional necessary modernizations that happen here, we're really thinking thoughtfully across the entire campus and making sure we know our full needs there. Critical care is a major area of expansion, our ORs. There's a lot of needs and additional love at all of our healthcare facilities, and Elmhurst is one of them. And so that I might have expanded my answer a bit, but healthcare infrastructure funding is really important for our system. Thank you.
And with the ambulatory care center also?
Yes, the ambulatory care center is in the design phase. We have a large quantity of projects in the design phase, but we are working to get that into the next step of procurement and construction.
Do you have an idea of when the timeline is for the start of the actual putting of the shovel in the ground for the emergency room expansion?
I would like to say next fiscal year, but I do want to caution just the back and forth of regulatory with the relocation of CPEP. We have regulatory sign-offs both from OMH as well as DOH state. So, and we also are looking and making sure that we're taking COVID into account in the design and ensuring that if there's additional lessons learned from that, we're integrating that into the design. So we just want to make sure that design captures the needs appropriately.
I just want to say thank you. I do recognize the challenge there between balancing, providing the health service at the same time, reconstructing the emergency room. But I think it was at the opening that we had, or the announcement of the extra funding from Borough President Richards at the beginning of the week, where it was mentioned by Dr. Kessler, the head of the emergency department, that they had 121 stretchers, I think, in the emergency room at one time during the COVID crisis. So it really is important that we get that accomplished. I just want to stress that. I know that you probably agree with me on that, but again, Absolutely. I just wanted to bring it up for your attention.
Of course, it's in my top 10 list because of the size and importance. And I think figuring out our services as we do that project is going to be very complex.
Yeah. Thank you. Okay, let me move on to telehealth equity. How is H&H directly working to eliminate telehealth inequity? How many languages is telehealth offering? And how does H&H support people living without technology or access to internet? And what more can be done to ensure the most valuable, the most vulnerable are reached with telehealth?
Thank you, Chair. Well, the best part is that we found that we can now use our system on people's smartphones. So the digital divide is much smaller around smartphones than it is around, people having laptops and home, cable. I mean, that we find very few of our patients have that. But smartphones, we find that almost all of them have. And so we've been using that heavily, and we have a full translation service, no limitations. People call, and it is all of, I think it's 140 languages as needed. So when someone, if even their smartphone does not work or they cannot handle the technology, then we do it as a regular phone call. And either way, we have full translation through our translation service.
And can you do ALS, American Sign Language, or ASL, I mean, with that as well? Because I do know some deaf people actually who do avail themselves of service, and sometimes it's a little hard to schedule the sign language interpreters.
Yeah, we actually find that obviously that requires the video. So if they do need to have a smartphone, but if they do, it works quite well. It appears as a box on the screen simultaneously. So we have been able to make that technology work. Okay,
thank you. Again, back to the issue of psychiatrists. I understand that there is a psychiatrist shortage. Has H&H included funding in the fiscal 22 executive budget to address this psychiatrist shortage?
Chair, because there is a national shortage of psychiatrists, this is not a case where our problem is necessarily that we're paying less than the competition. There just simply are not enough psychiatrists. So most of our work to date is trying to figure out alternative models. We're hiring more psychiatric nurse practitioners who can prescribe. We're hiring more psychologists. They cannot prescribe, but they are equally capable of diagnosing serious mental illness. We're trying to move all of therapy to licensed social workers, psychologists, so that the psychiatrists can function as needed to do our prescribing. We're working with the state to try to decrease the sheer bureaucracy of a inpatient admission and discharge, which makes a lot of people not want psychiatrists, not want to do the work. So I think the major changes have to be workforce related. And I do, Bellevue is the center of, public psychiatry in the world. And I feel like we should be the ones who are saying, look, yes, ideally we would have a lot more psychiatrists, but that's not going to happen. They're not being produced. They're not going into public work. Many of them choose now to do therapy through telehealth themselves. So then we need a different model because the patients still need care.
Are there any incentive programs to get people to go more in that direction?
So to choose psychiatry.
Yeah.
We don't have now, again, part of the problem is that if you think, Chair, sort of what the process is, that decision of going into psychiatry determined often at the medical school level. Someone makes a decision, I'm going to be a neurologist, I'm going to be an ophthalmologist, I'm going to be a psychiatrist. We do want to and have incentive programs to increase the number of unrepresented minorities among our physicians, which would include psychiatrists. But I'll go back and also look and see whether people have other ideas on how we might either get more people to join and decide to be psychiatrists, or more people interested in public sector psychiatry.
Okay, thank you, Doctor. I have some more questions, but I'm going to turn it over to my co-chair, Chair Rivera, to ask questions, and then I'll follow up if when she's done, or if there are other council members who have questions after they're done. Thank you.
Thank you.
All right, thank you so much, Chair Drum. And again, thank you. Good to see you, Dr. Katz. Looking forward to seeing you and a lot of your team, as soon as possible in person. So just get right into some questions about some federally funded new programs. You touched on this a little bit. I realize there are a lot of things that play here with the FEMA reimbursements and the money that came from the federal government. So I'm going to ask about federally funded new programs. And I'm really excited about two major new programs that are being introduced at H&H, the Mental Health EMS and the Public Health Corps. So with $41 million and $50 million allocated in fiscal year 2022 with mostly one-time federal funding, I want to make sure that the programs are fully supported by H&H with responsible spending for a successful and sustainable program, of course. So the $50 million Public Health Corps, that's an extension of the Test and Trace program, right, T2. T2 initially went through H&H instead of the Department of Health and Mental Hygiene for the ease of contracting. However, now that this program is being extended, we would want to move away from contracted services and into directly hiring city employees. Is there any benefit to having this program housed in H&H over DOH-MH at this point?
Well, the T2 did involve hiring 1,000 people. So I think part of the decision to go with health and hospitals was also our hiring is faster. To me, of course, it's always about mission. I am happy to hire people and have them work under other people's supervision. To me, it's all about how do you get the work done, right? It doesn't matter to me. I can hire them and they can work in whatever formation people think would achieve the best goal. I think the idea, and you did relate to this, Chair, in your comments, many people need care, but for whatever complicated set of social, economic reasons, have challenges making it to the doctor's office, making it to the hospital office. And so then I think the question for if the goal of the Public Health Corps is to reach people where they are, and bring them into care, do you want to connect them to the agency that provides the care? just us, or do you want to create what would have to be a warm handoff? And there might be reasons in both directions, but I think the idea of continuing the employed people, especially in health and hospitals, was that we would then be able to say, we want you to see our colleague at Sydenham. We want you to see our colleague at Harlem. We want you to see our colleague at Gouverneur, and actually bring the person as an H&H outreach worker to the site of care. So I think that's the model we're currently working under. If I'm always open, I love working with the Department of Health and Mental Hygiene, so I'm happy to switch the model if that's what people feel is best.
Okay, well, and I appreciate that, but who's going to be hired for the Public Health Corps? Like, what are going to be the requirements and training? And is there a path toward a professional certification or licensure to be a healthcare provider?
Right, so the goal would be to first focus on those people who are currently employed by us. So they're already our employees at health and hospitals. And we would do trainings. It's a good question. I haven't thought about whether we would try to do a specific certification, but I would certainly be open to that. We want people who represent the hardest hit communities, and our hiring was focused on those communities to hit the highest percentage. We are very focused on language and cultural competency. So those have been the major drivers of who's in the program, and we would try to keep it that way.
And how does this integrate with the services already provided by NYC Care?
So NYC Care, which we're very proud of, it was based on the idea of coming, a promise of a doctor's appointment or nurse practitioner's appointment in 2 weeks for your own provider, and then whatever else you need. I think what we've learned through, the COVID is that there is a large group of people who, for whatever reasons, don't make it to the front door, and who need a, more hands-on from the community. Let me bring you to the front door. And so the idea would be that the core members would help us to increase membership in NYC Care, keep people coming back, keep people taking their hypertensive medicines, make sure they don't run out of medications, which happens all the time, even when you solve the economic problems, just because people's lives are busy and other things are going on. I find that my own patients, run out of medicines. And I say, well, but they are provided free. You just needed, the refills are there. Sometimes people need a little bit of extra help. They're so busy focused on supporting their families that they forget that it's important to take care of themselves.
And I understand that, and I just want to go back to, right, that's why I thought the community-based organization, the relationships there were so important. And some of the questions I ask about certification and licensure, because we do want kind of this seamless transition, whatever happens. We want to make sure people in the community are receiving these sorts of messages. The messaging is coming from people they know. And I know H&H was working with community-based organizations on outreach for the past year. And I want to ask, why was the vaccine outreach contract for $9 million in vaccine outreach transferred to H&H? And then how is this going to impact the relationship with these community-based organizations and the Public Health Corps?
I just want to make sure we have the same program. So Department of Health and Mental Hygiene has released the new RFP that's via them.
And just really quick, Dr. Katz, right, because the community-based organizations will have to reapply for this RFP, even though they were in the old program. I know you're going to make a distinction, but I just want to clarify that.
Yes, but they don't have to reapply for the old money. So if they were getting money already, and I think it's 35 agencies were getting money, it's our belief, we will be going to our board, but we'll be asking our board to extend those contracts for all agencies that have satisfactory performance, which is overwhelmingly the agencies. Separately, those same agencies or agencies that are not part of that pot can apply for the additional $7 million being released through the Department of Health and Mental Hygiene. Does that make sense? So if you're receiving the amount of money that, if you're already doing what you want to be doing, then assuming my board approves the continuation, they will not have to reapply. But to get additional dollars, or if they're not in that group, they will have to apply under the DOHMH RFP.
I know, and I guess and I appreciate what you're saying. I guess what I'm looking for is the acknowledgement of, like, is DOH the better agency for this kind of work? Or is it just that DOH was the only agency eligible for this funding? And I'll ask you a question about vaccines as well, because this ties to the community-based organizations. But considering all of this planning and the public health core and the incredible work that H&H has done and DOH's role, there is only funding for fiscal year 2022. And so what is H&H's plan for future years? And considering that the federal funding is one time, does it not make more sense to spread the funding over multiple years?
Well, just on the last part, just if we spread over multiple years, it would have to be smaller. And so my hope is that there will be other sources of reimbursement for these kinds of services, that the world has learned, as you said in your opening comments, how important primary care is to preventing disease. But I don't yet have a source to tell you it is going in the future. But I do, and I think you would agree with me, the need is now. So I do want to address the need, and then try to work creatively to continue. As I said before, to me, whether something comes out of DOHMH or something comes out of us, it should come out of wherever it can be done more expeditiously. I don't have any ownership or need for ownership. I just want to see the services delivered rapidly in a culturally competent way. We love working with the community-based organizations. I think that particular RFP, many of those relationships are longstanding with DOHMH, and so it was felt that was the best place to do that RFP. Again, I think whatever the tensions that existed before, at least at the department level, do not exist currently. Dave Chotsky and I talk almost every day. We figure out with each issue how to get it best done. I don't believe there is tension any longer.
No, and that's great. And I want us all to be working together. And why I think I've been ringing the bell for probably a year at this point about the community-based organizations is because of people's hesitancy even today. Pre-pandemic, it was primary care and getting people to have primary care physicians, but now there's a little bit of vaccine hesitancy, and there are many, many reasons. And so I just did a pop-up vaccine in the Murray Hill neighborhood, and granted, we have a wonderful hospital row, but I think sometimes going into a hospital can be a little bit overwhelming. And so having pop-up sites that people can go to, I think have been incredibly helpful and a little bit more welcoming than kind of that standard entrance into a hospital. So I want to ask about vaccine incentives, because I was expecting more people to get vaccinations at this site. And though there are many, many reasons, I do know that some of the issues, I don't know if maybe it's vaccine incentives, and the state just announced this scratch off incentive at state sites, and city sites do have various incentives. We all saw the burger and fries press conference. That was cute. But has there been any discussion at all around providing money to people who get vaccinated who do not have paid time off? I do feel that there are many people who hesitate because they worry about taking off work. I think the incentive is probably a no-brainer at this point. It aligns with T2 supporting people who need to isolate, because of COVID who don't have paid time off. And I know there's been a suggestion that offering about $200 to people who are low-wage workers and who worry about taking time off, it would allow them to get the vaccine. And why I bring up money is because we do have incentives at some places, yet none kind of directly address the inequities that cause barriers to getting people vaccinated. And someone who doesn't have paid time off likely will not benefit from what's a low chance of maybe winning like Knicks playoff tickets.
Right.
So, you know, I was wondering if you could just address kind of what's the next step in reaching our next milestone for vaccinations.
Well, thank you, Chair. And I think you hit a lot of the high points. I just want to say, because I sit in an exam room at Gouverneur, that there are people who continue to fear the vaccine, who even they're my patients. I say to them, I really want you to get vaccine. And they say, not now, not ready, not trusting. Those people, we need to keep working on them from an emotional, psychological, cultural point of view. But then I agree with you, and I like your solution. There's been some concern about financial incentives only on the side that no one wanted to be seen as putting undue influence on someone to get something that they didn't want. But I love your idea. I don't see providing essentially a sick day, which is city employees we get, paid time off. I don't see that anybody would consider that a undue incentive to get vaccinated. They're just getting the same thing that you or I are entitled to get. So I would 100% support that, and I will bring that back to the group. I think everybody with the lotteries is trying to figure out, what does move people, and it's not going to be one thing. It's going to depend upon, which is the reason that they are, not wanting to be vaccinated at that moment.
Absolutely. And I know we're getting near kind of the time. So just two more quick questions. I wanted to follow up on Chair Drum's comment about psychiatrists. I know we all know there's a psychiatrist shortage, and we're hearing that Gotham clinics aren't really being provided funding to address mental health worker attrition. And can you just confirm that Gotham clinics will be providing funding to address these attrition issues if they have identified potential hires?
Yes, I have no holds on hiring. All clinicians, I have no holds on clinician hiring. All clinician positions are open. Doctors, nurses, mental health professionals of every kind. We will hire every good mental health clinician we can find. And we are actively recruiting and actively hiring.
Okay, and so I just want to put I visited Jacobi Hospital with Councilmember Riley, and they were in desperate need of a child psychiatrist. If not, they said a psychologist. I know I've brought this up because they do have young people, 7 and 8 years old, suicidal ideation, and they just don't have the resources to address that very serious issue. So if I could just put that plug in for the Bronx. And then just my last question, since we talked a little bit about headcount and hiring, how has the pandemic affected registered nurse retention at H&H? And can a list of staff by title be provided for each facility?
So we'd be happy to provide that. I'll ask our, very good Chief Nursing Executive Natalia Sineas to provide that for each facility. I think so far we're good. I think a lot of us have fear that when the pandemic is really over, we will have a lot of retirements. I think there are a lot of people who keep coming to work because they know how important it is, and that we've needed every nurse that we can hire. I do worry that, when we enter the next phase, if we're lucky enough to enter the next phase, and we have, very few patients who have COVID, we've been hovering around 40 patients in the ICUs. We actually had our first hospital have no COVID patients in the ICU this week, Metropolitan. We've had about 140 COVID patients still in the hospital. But of course, given that we once had 3,700, you know, it's quite small. But I do worry, you know, the nurses have been amazing heroes and sheroes through this, and I do worry that there will be retirements when people feel like, okay, I did my pandemic thing, you know, I came in, I stood up, and now I'm entitled to a rest.
And, you know, I would say you've had a pretty intense 4 years yourself. So I want to acknowledge that. And I'm glad to hear you also mentioned the hiring of clinicians. I know at the Roberto Clemente Mental Health Center in my district, I just want to mention that they want to hire social workers to help with some of the mental health services that they're providing, but they said they've experienced some challenges in that hiring process. So I'd love it if we could follow up on that to make sure that they have what they need, because it's such an important institution. And wanted to thank you, of course, you know, as we reflect over the past 4 years for everything you've done and how you've worked to turn around H&H and for all of your staff and every staff at every hospital. I just want to thank you. I'm going to turn it back to the chair to see if there are any questions from my colleagues. And again, Dr. Katz, thank you. And everyone that's here from your team.
Thank you.
Marty, John, everyone, thank you.
If any council members have questions for H&H, please use the Zoom raise hand function and you'll be added to the queue. Council members, please keep your questions to 5 minutes, including answers. Please wait for the sergeant at arms to tell you when your time begins. The sergeant will then let you know when your time is up. We will now hear from Councilmember Dharma Diaz, followed by Councilmember Brooks Powers.
Good morning, and thank you for the opportunity. It's not a question, it's more a token of gratitude. During my COVID experience, I chose to isolate through the program established by HHC, the customer care. It was amazing. And one of my weakest points to have people from entering into the hotel to the teleconferences to the follow-ups. I was extremely impressed that you were able to find individuals that showed compassion, and so just thank you. It allowed for my mental health to remain positive. I'm glad that I had chosen to isolate. As if I ever was tested positive, I wanted that to be my experience, to isolate for fear of exposing my family. So again, just thank you for that opportunity to have been able to isolate and walk away proud to be a part of New York City and knowing that when many systems don't work, this one did work. Thank you.
Well, that's wonderful. Thank you for sharing that experience. Thank you for protecting our community by isolating yourself and giving me a minute to say we ran 5 hotels. We walked people's dogs. We picked up people's medications. We ordered all kinds of foods for people. We did whatever. We arranged transportation door to door.
Yes.
Whatever was necessary. So thank you for highlighting that.
You're very welcome.
No sweat. We will now hear from Councilmember Brooks Powers.
I'm sorry, no.
Good afternoon, and thank you so much for taking the time to speak today. I would like to first say thank you to your staff who have been very responsive since I have assumed the city council position for the 31st district, representing parts of Southeast Queens and the Rockaways. I do have some areas of concern, some of which are already being addressed in terms of the access to vaccinations. Coming into the seat, we did not have any permanent sites, which we now have 3 permanent sites in the Rockaways. So I do want to acknowledge and thank you for ensuring that we were able to receive those sites. I also urge us moving quickly in terms of the other side of my district in Southeast Queens to establish permanent facilities there as well, considering that we still fall on the lower end of vaccinated residents. Also, I've received questions in the community in terms of job opportunities. And I know you spoke about like clinician positions, but even in terms of like the testing sites and the vaccine locations, we have, for example, one of the earlier ones was a testing site in Edgemere, which is now turned over into a vaccine site. And the community would love to see locals hired for those positions, creating that opportunity as well. I did like that, and I'm eager in understanding health and hospitals plan to be more aggressive in the communities hardest hit in terms of what that access looks like. And then the final piece I like to just highlight in terms of the pop-up locations, the incentives, if we can look and get creative with what incentives can be offered to some of these organizations who are struggling and doing their part to open up their facilities to have these pop-ups. For example, there is no one that will come behind and kind of clean up what is left behind, or even any type of financial incentive for this. And so I'm just sharing some of the concerns that I've heard more locally. I'm not sure if that translates into other districts, but I did want to highlight that. But I will also close with saying thank you once again to your staff, because they have been very responsive and very supportive of the needs. So thank you so much for this time.
Thank you. And I wrote down all those issues and I will work on them. Socioeconomic status is the best predictor of health. And so hiring locally is a way of providing health. So I'm very focused ourselves on hiring people, getting them good jobs. That will bring greater health. So I thank you for your comments, and I have notes and we'll work on those issues.
We will now hear from Councilmember Moya.
Time starts now.
Thank you. Thank you, Dr. Katz. Always good to see you. I just would like to reiterate the points that Councilmember Drum made about Elmhurst Hospital. You know how much we care about Elmhurst, and we just hope that equity stays the same as we go forward in its funding. My question, Dr. Katz, is, you know, you've mentioned more about the testing vans and the vaccination vans. H&H, when the H&H vans go out, it's great service. No complaints, nothing like that. But it's the contracting that is done with the vendors, and I might have mentioned this one of the times that we saw each other, is really the problem. So in communities like Corona, the epicenter of where this pandemic happened, when we wouldn't get an H&H van and we'd get the vendor vans to come out, there was no signage. Folks there were not bilingual. We had to have staff out there talking to folks. The lines were really long. How do we go about vetting these vendors, and like, what is the criteria to select them? So if we're going to have more vans out there, if there is going to be contracting with other vendors that are not H&H vans or H&H staff out there themselves, what is the criteria? Who is tracking that? Because it's super important that if we're going to send these vans out into the communities that are most impacted by it, communities of color, immigrant communities, that there's the appropriate staffing and that there is somewhere where we can actually talk to folks if we see problems like this continue to arise when these vans are out in our district.
Well, thank you, Council Member. And again, I want to thank you and Chair Drum for coming this week to celebrate the gifts to Elmhurst and for being such great supporters of Helen Ortega as the new CEO. She's doing a a phenomenal job, and we couldn't be happier to have
We
her.
love Helen.
Yeah, Helen is a very special person. I'm a public sector guy, of course. I believe in, well-paid union jobs for people from the community. And so, I try to do things as much as I can through the public sector. Sometimes expansions have to happen rapidly, and we have to rely on vendors. And certainly that was the case in some of the T2. And unlike longstanding arrangements that we've had with CBOs, where we know them very well and we know whether they're capable, I admit it was, hit and miss. We had some great vendors who, really did well, and we had some who did not do so well. And I, feel it's what is then our responsibility, helped by people like you who give us honest, direct feedback, which I always encourage. I never mind hearing negative things, because that's how you fix things. You can't fix things unless you know that there's a problem and can acknowledge it. So we will, I think we'll have fewer and fewer vendors. And I know that Dr. Long talked with the vendors about their language inadequacies. There were some things they did not know of at that time, and we'll continue to improve performance. But thank you very much for raising the issue.
We will now hear from Councilmember Rosenthal.
Time starts now.
Thank you so much. I appreciate that, and great to see you, Doctor. I heard Councilmember Moya raise this point about contract vendors, and I just want to double down on that. I'm impressed that he even knew that the vendor was there at all, that the truck was there. I got no notification and was walking by and noticed it and talked to the person who was giving out shots, and he said, yeah, he was, he actually knew the Upper West Side, and he too didn't understand why they located the truck.
They shouldn't have put it where they put it. There were much.
Councilmember, we cannot hear you.
Locations that could have really helped more people, but it wasn't really in.
Councilmember Rosenthal, we can't hear you.
Oh, did you?
Councilmember Rosenthal? Councilmember Rosenthal?
Did you lose me? I'm sorry.
Yes.
Do you hear me now?
You can hear you now.
Apologies. I don't know how much you missed, but basically doubling down on what Councilmember Moya said. I was not notified, and the location it went into really just made no sense. There were, if you're going to come to the Upper West Side, which we love, there are places that really need vaccines. And I think my office could have been helpful in letting somebody know the location. So,
got it. I
what's
understand.
the coordination, I guess, or?
Yes, we will do better, Councilmember. Thank you for raising it.
I mean, going forward, the guy said that it was a contract agency working for H&H. Can I expect another van coming out? And do you think it would be possible for them to contact my office? Because I have some ideas where we really do need them.
We will do that. We'll contact your office today.
Thank you very much.
Thank you.
The reason I bring it up and the reason it's important, and I double down on it to Councilmember Moya's point, we're spending money on these contract vendors. And I don't care if it's reimbursed by FEMA or not. These are limited tax dollars.
Agreed.
And if each of us, if these two council members have had this experience, how many more? You can't say you have 20 vans out there and be proud of it if 19 of them are in the wrong location and not vaccinating any of them, or even if 2 of them are in the wrong location and not vaccinating anyone. And this truck was there for 2 weeks. So I think it's sort of a whole cloth review and I'm sure you have someone dedicated to this. So just sort of asking your team, I mean, sure, come back to me and fix it for my district. But I think it's a systemic, I would say, and the only reason I spoke again, because Councilmember Moya brought it up, is that if he's seeing it, if I'm seeing it, that counts as systemic.
Understood. Thank you.
Appreciate your time.
Okay, I would like to announce that we were joined by several other council members. Hold on a moment. They are or were Councilmember Gibson, Ayala, Levine, Reynoso, Rosenthal, Majority Leader Cumbo, Minority Leader Matteo. Okay, and I just want to see if Councilmember and Chair Rivera has any additional questions before we close out.
No, I just want to say thanks again to everyone. As for the mobile vans, I would love to see a mobile vaccination van on Avenue D in my district, right beside thousands and thousands of NYCHA families. Love to work with you on that. And just to thank you for everything thus far. I'm looking forward to a continued partnership. And thank you to Chair Drum for being an incredible leader.
Thank you. Doctor, I forgot. I do have one last question, and it's really important to me, and I think probably to you as well, which is transgender healthcare trainings and data collection. So can you provide an update on the current funding amount, the number of personnel, the program activities, and the program outcomes for the transgender healthcare training that was baselined in 2020 in the executive plan?
Let me ask John if he has that number. If not, we will get it. But let me reiterate. I mean, we see this as a key issue for us. It's part of our affirming all populations, and we want to make sure that our services are culturally appropriate for people who are transitioning. John, can you provide the numbers today, or will we get them to the chair?
Yeah, we will get them to the chair. I know this is an area that we keep trying to expand with the resources that we have, but we will get you a full accounting of the numbers.
Okay, and Dr. Katz, I believe you only have 3 outreach workers there. Would love to see 5 because we have 5 boroughs. And I think that the other 3 are assigned to a borough each. And as Debbie Rose constantly reminds me, Staten Island is a borough too. So would love to see outreach there. And can you maybe just include who those folks are when you get me the information about the transgender healthcare program? And finally, let me just bring up this issue to you. Does H&H collect data on sexual orientation and gender identity for each person who interacts with H&H service?
Yes, it is. It is part of our EPIC rollout, is that we collect that information.
And how is that done? That's done like on somebody voluntarily offers that information, or is somebody given a slip? I know that when I went to a private hospital in Western Nassau, for example, they actually handed me a form and you just checked off voluntarily, and then they translate it or they put it into the computer. How is that done at H&H?
It's done in more than one way. If the person registers through MyChart, which is what we encourage, that they would put it in themselves, which I think is the best system. But if they're coming in person, then they would put it on a piece of paper or tell the person. And of course, it is voluntary. We don't make anybody, but we encourage and hopefully create the kind of warm environment that people know we welcome everyone.
I just think having that question indicates to LGBTQ people that in fact you're open to that, and that it is a warm and welcoming environment. I do see the posters that you have around the hospitals as well. Want to encourage that more, that you keep them up, and that really, when I walk into H&H and see that, it makes me very proud to see that, H&H is doing that type of outreach. So I'm very glad to hear that you're doing this. It's really vitally important. I mean, for me, having a doctor know that I'm gay is important because I think you can better address my healthcare situation knowing that than if he didn't know that. And rather than me having the initiative to always continually come out, if it's right there on the form and the doctor can see it or whatever, I think it's much better and much easier.
Totally agree.
Thank you. And I think Chair Rivera has a final wrap up. Can't let you go, Dr. Katz, you see?
No, not yet. Sorry, because, you know, in the beginning of my questions, I mentioned these two initiatives, and I just want to ask you about the mental health EMS. So the mental health EMS program, which will employ EMS workers and social workers to co-respond to nonviolent mental health crises through 911 calls, is budgeted at $90 million for fiscal year 2022, 41 million of which will be allocated to H&H. And this program too only has 1 year of funding and requires the hiring of hundreds of new employees within the fiscal year. So why is H&H the best agency to hire these social workers, which we also desperately need? And what funding will be used to sustain these hires over future fiscal years?
Well, I'm going to let John do the financial part, but from programmatic point of view, I thought it did make sense for us to do it because we're running all the psychiatric emergency rooms in the city, including there are no private psychiatric emergency rooms. They're all public. And so I felt that by us doing it, we stand the best chance of being able to know the patient. So we may know them before we actually meet them through the system because they may have experienced care, which would give us a heads up on whether this represents a worsening of their condition or this is a new break for them. And the feeling that, you know, we have most of the active clinicians, both for child and adult. So that's why it's here. John, do you have the financial information?
Yes, I think, you know, while we're grateful, right, for the funding, right, and it allows us to, you know, experiment with new models of care. I think one of the things that we've learned throughout COVID is, you know, different ways to meet the patient. And we talked a lot about that, you know, during the course of this conversation, including, you know, 65% of our patients are now enrolled in MyChart. I guess it's a long way of saying that we have to get the dollars to match where we're meeting the patient to provide care. So this will be something that if, you know, successful, right, we will have to find the financing to make it work. And there's ways to do that. There's obviously creative, you know, waivers that we can ask the federal government for. You know, there's subcapitation payments and working with insurance companies, but that's my job, right? I got to find ways to make models of care that work. I got to find money for them. So we will start working on that now.
Certainly, I'm not sure if H&H is expecting any more federal funds to come in, but I appreciate all that you're doing. And I know that, you know, mental health outreach has been so incredibly important, especially the past year and more, where people haven't had the same access to services and programs. So thank you, Mr. Chair, for indulging me in that last question. And thank you again to H&H for doing the best work that you can given the circumstances.
Thank you very much. And thank you again, Dr. Katz, and to everyone on the H&H team. We really appreciate you coming in.
Thank you. I appreciate it.
Thank you again. Okay, now this will conclude this portion of today's hearing. Thank you, H&H, for being here. We will now move on to the City University of New York. I ask my colleagues who will be joining us for the Q&A portion of the hearing to remain in this Zoom with your microphone muted, and we'll be ready to start momentarily.
Good morning, Chair Barron. Can I get an audio check?
Good morning. Can you hear me?
Yes, actually, it's good afternoon. Sorry about that.
Oh, thank you. I'm glad you got me reminded of that. Yes, thank you.
All right, I can hear you loud and clear.
Thank you.
All right, whenever you're ready to go, just let us know.
2 minutes, 10 seconds.
Okay, you got it.
Okay, I'm ready.
Okay, great. Good to see you.
Hi, Danny. How are you?
I'm doing well, thank you. Good to
You're
see
doing a
you.
great job.
Thank you very much, and so are you. Thank you.
Thank you.
I think this is our first hearing together, if I'm not mistaken.
Didn't we do it last year?
I'm not sure.
I think we did.
Okay, good. All right, good. Okay, it should have been. All right. Good afternoon and welcome to the City Council's 8th day of hearings on the mayor's executive budget for fiscal 22. My name is Daniel Drum and I chair the Finance Committee. We previously heard from H&H and now we'll hear from the City University of New York. We are joined by the Committee on Higher Education, chaired by my esteemed colleague, Councilmember Inez Barron. Let me introduce who's here with us today. We are joined by Councilmember Adams, Amphrey Samuel, Ayala, Brooks Powers, Dharma Diaz, Gibson, Grodenchik, Koslowitz, Lewis, Maisel, Moyer, Rosenthal, and Minority Leader Matteo. In the interest of time, I will forego an opening statement, but I would like to turn it over to Chair Barron for her statement.
Thank you very much, Mr. Chair. Good afternoon. I'm Inez Barron. I'm the chair of the Committee on Higher Education, and I would like to welcome you all to our virtual hearing on the fiscal 2022 executive budget, including the fiscal 2021 through 2025 executive capital commitment plan and the 10-year capital strategy for the City University of New York, CUNY. We are joined by Felix Matos Rodriguez, CUNY's Chancellor, Matthew Sapienza, CUNY's Senior Vice Chancellor and Chief Financial Officer, Hector Batista, Executive Vice Chancellor and Chief Operating Officer, and Jose Luis Cruz, Executive Vice Chancellor and University Provost. Thank you for joining us today. I do want to make mention that on this past Wednesday, May the 19th, we celebrated the birthday of El-Haj Malik El-Shabazz, who was referred to as our shining prince. It's been my honor to serve as chair of this committee since fiscal 2015. In those 12 and now 13 separate budget hearings, I have made clear just how important it is for faculty and upper management diversity, tuition costs and those impacts on affordability and accessibility for students, and childcare supports and increases in the base aid from the state. Today, as I join you for my final budget hearing as chair of the committee, I'm re-emphasizing my position in all of these areas and more. I just want to talk briefly about this painful pandemic that has spotlighted and magnified the grave inequities in our communities in social and economic arenas. In Black and Brown and low-income communities, there are pre-existing conditions of being marginalized, being obscured, being patronized, being under-resourced, and being underfunded. These systemic practices, in addition to the racially weighted response given by the state and local governments, exacerbated the negative impact and results of this pandemic. We've heard the expression, we're all in this together, which implies some kind of sameness in weathering this storm. But we're in different boats. Some are only in rafts and some only have life preservers. But in this storm, many of those with responsibility and the ability to implement changes and take bold actions to ameliorate these injustices had the opportunity to address the inequity, and many of them did so. Unfortunately, the president of Hunter College, who has sole authority to determine the admission criteria for Hunter College High School, decided to continue the policy that has resulted in only 2% of that student population of Black students. Continue that policy, which has limited the number of Black students, although we've had years of protests and concern from students and alum that there's a gross inequity. And if we believe that Black and Brown students are equally qualified academically, we must be using a tool that is limiting and denying them the opportunity to come. We're very upset about that, and we will address that further. I also will need additional clarity from CUNY on the accounting of all of the federal stimulus aid it has received and will be receiving to offset revenue losses, cuts from the city, and how remaining funds can be used towards investment in student services, especially in the areas of mental health and student advisement supports. I need to know if the Office of Management and Budget is working with CUNY to ensure there is sufficient funding in CUNY's budget to attract, retain, and hire adequate staff and teachers currently. These issues are all very critical to manage right now, and we need to ensure taxpayer dollars are being applied efficiently and best determine how and where stimulus aid can and should be applied into the CUNY system. As the city gets ready to open up and CUNY prepares to return to a portion of in-person services this fall, questions arise like, will there be enrollment spikes as students feel safe again and are inspired to re-engage in their educations? Will CUNY raise tuition costs on its students this coming year or next? Will agency partnerships support CUNY as CUNY has historically worked to train and teach so many of our city's employees? And is the city and CUNY taking its rightful position to ease the current economic and social pains for its students? And in preparation for the mayor and OMB thoughtfully considered what is a fully funded CUNY would mean as a booming engine of recovery for so many city residents and students. And lastly, I want to hear from CUNY what its budget requests and priorities are for fiscal 2022. So this afternoon, I will ask CUNY a series of questions to attain greater clarity for this body to perform the task ahead of us as we work towards adopting the fiscal 2022 budget. Everyone knows the task ahead of us, so let's be productive and engaged hearing as we do what's required to support our city's current and future students at CUNY. CUNY's fiscal 2022 executive budget of $1.2 billion adds funding to support new needs and 4 new initiatives and introduces intra-city transfers typical during the mid-year, with 1 substantial tuition revenue adjustment in fiscal 2021, primarily due to under-enrollment this past year. I also look forward to learning more about how the university is wrapping up projects this fiscal year and next within CUNY's $603.3 million capital commitment plan. Before we begin, I would like to take this moment to thank my staff, particularly William Clay, my chief of staff, M. Indigo Washington, my director of legislation and CUNY liaison, Michelle Peregrine, the finance analyst to the committee, Isha Wright, the unit head, Amy Briggs, counsel to the committee, Chloe Rivera, senior policy analyst to the committee, and Frank Perez, the committee's community engagement liaison. I also want to thank all of my district office staff and all of those who have worked diligently with me during my tenure at the council. I want to give special thanks to my fellow members of the BLAC, the members of this committee, our speaker, Corey Johnson, for his leadership, and of course, Chair Danny Drum, my esteemed colleague, not just here in government, but from teaching as well, who works tirelessly during all of these executive budget hearings to inform the body as well as to work to pass the budget. And big thank yous to LaTanya McKinney, the director of the finance division, Regina Pudveda Ryan, and Nathan Toth, the division's deputies, and the rest of the council finance for all the hard work and dedication to this process. And I also want to thank those persons behind the scenes for all of the technical assistance that you give. And of course, I want to thank my family, my husband, Charles Barron, for all of the love and support day in and day out. I have been blessed in so many ways with life's riches, and I'm grateful for this important work to get to participate in for the good of this dynamic city. Chair Drum, I turn the hearing back to you. Thank you.
Thank you very much, Chair Barron. And I really appreciate your very kind words and your closing there. Yes, we are very privileged and we are very lucky in our lives. I feel the same way, very blessed that we've been afforded this opportunity, and especially that I've been afforded the opportunity to work with you over the last 8 years in the City Council. I look up to you and admire your enthusiasm and your advocacy very much. Thank you, Chair Barron. And bienvenido to my friend, former Queens president, Queens College president, Felix Matos Rodriguez, now the CUNY Chancellor. We welcome you, and I'm very happy to see you again. I look forward to hearing your testimony. I'm going to ask our council to swear you in, and after that, your testimony, and then we have some questions for you.
Thank you, Chair. My name is Stephanie Ruiz, and I'm counsel to New York City's Council's Committee on Finance. Before we begin, I want to remind everyone that you will be on mute until you are recognized to speak, at which time you'll be unmuted by the Zoom host. If you mute yourself after you've been unmuted, you will need to be unmuted again by the host. Please be aware that there could be a delay in muting and unmuting, so please be patient. During the hearing, if council members would like to ask a question, please use the Zoom raise hand function and you will be called on to speak. We'll be limiting council member questions to 5 minutes, including responses. I will now administer the affirmation. Do you affirm that your testimony will be truthful to the best of your knowledge, information, and belief? Chancellor Rodriguez?
Yes, I do.
Thank you. Mr. Jose Luis Cruz?
Yes, I do.
Thank you. Mr. Hector Batista?
Yes, I do.
Thank you. And Mr. Matthew Sapienza?
I do.
Thank you. Chancellor, you may begin when ready.
Thank you, and good afternoon and buenas tardes, and to chairs Drum and Barron and teachers Drum and Barron. Thank you for your leadership and your support. And to the members of the New York City Council Committees on Finance and Higher Education, many friends in those committees and many supporters of the City University of New York, to staff and the guests. I am Felix Matos Rodriguez, a chancellor for the City University of New York. I'm delighted to be joined this afternoon by the Executive Vice Chancellor, University Provost Jose Luis Cruz, our Chief Operating Officer, Hector Batista, and our Chief Financial Officer, Matthew Sapienza. Thank you so much for the opportunity to testify this afternoon. I am proud to be able to share today how the City University of New York stood strong against a relentless pandemic and outline our priorities, plans, and goals for the coming fiscal year and beyond, and answer any questions that you might have. I am extremely honored and humbled to oversee the premier and largest urban university in the United States, serving 500,000 students, 9,000 faculty, 21,300 staff at our 11 four-year colleges, 7 community colleges, and 7 graduate and professional schools. On behalf of the entire CUNY community, I want to thank the New York City Council for your past and sustained support, which has enabled CUNY to deliver strong results for our students and the citizens of New York City. 2020 was a year that both demanded and inspired great fortitude and resourcefulness from our students, faculty, staff, and leaders. The coronavirus forced CUNY to all but shut down its 25 campuses in March of 2020 and quickly pivot to distance education. When classes resumed after a week-long academic recess, 95% of the university's 50,000 course sections had transitioned to online instruction. We quickly realized that thousands of students lacked the tools to participate in distance learning. In response, we purchased 33,000 laptops and tablets and made sure that they were safely distributed to students in need, and later provided 4,000 personal hotspots for those students who require Wi-Fi access. It was just one part of our broad efforts during the year to help the students weather the academic, economic, and emotional challenges they faced. Our efforts to support students certainly did not stop there. Early in the COVID-19 crisis, we established the Chancellor's Emergency Relief Fund with $1 million each from the Carol and Milton Petrie Foundation and the James and Judy K. Diamond Foundations. By default, Support from additional donors grew the fund to more than 10 million and allows to distribute emergency grants to more than 12,000 students. Individual colleges and schools on their own raised more than 8.6 million, enabling them to help 1,000 students more for a total of nearly 17 million in emergency relief funds in private philanthropy collected across the university. We were also among the first systems in the nation to begin awarding student emergency grants that were funded by the Federal CARES Act. We have now fully disbursed our Federal CARES Act student emergency grant allocation, with almost 161,000 students receiving awards, averaging $736 per student. Earlier this month, we began distributing the second part of $180 million in federal emergency grants, part of the pandemic relief package passed by Congress last December and made available to the nation's educational institutions in the spring. The second round of the federal relief funds, called the Coronavirus Response and Relief Supplemental Appropriations Act, which we call CRRSA for short, provides grants averaging about $750 to help students meet educational and living expenses during the pandemic. More than half of CUNY's 270,000 degree-seeking students qualify for the CRRSA emergency grants, with the average amounts ranging from $600 to $1,100, depending on the student's financial need and factors including full-time or part-time enrollment status and whether they support dependent children. I am pleased to report that we have already dispersed almost $114 million of the second federal allocation, and over 151,000 CUNY students have received awards in the recent weeks. As part of our CRRSA allocation strategy, we required CUNY colleges to reserve 5% of the funds for future discretionary awards to students, including the possibility that the federal government may allow them to be dispersed to international students, Dreamers, and other undocumented students for the first time, because that did not happen during the CARES Act. We were therefore thrilled with the decision announced last week by the Federal Department of Education to reverse the previous administration's policy of barring undocumented students from receiving federal pandemic relief. This important decision corrects a grave inequity in the distribution of funds that started with the last spring's CARES Act. The new policy would allow colleges and universities to distribute federal pandemic relief to enroll students who need financial help, regardless of their immigration status. We are now working to release these grants to Dreamers and other undocumented and international students. These thousands of students will also be eligible to receive emergency grants from the American Rescue Plan package signed by President Biden last March. We are also working on our campus budget allocations for fiscal year 2022, which will include the institutional funds from CRRSA as well as the resources becoming available now from the American Rescue Plan. CUNY joined the city's battle against the coronavirus on many fronts. Campuses used 3D printers to produce PPE equipment. Experts at the School of Public Health and Health Policy produced a weekly tracking survey of New Yorkers' attitudes and behaviors towards the pandemic. CUNY scientists repurposed their work to take on coronavirus-related research. One project that gained national attention devised a process for monitoring the level of coronavirus in the city's wastewater to help identify new outbreaks before testing did and guide health officials' responses. The long-awaited coronavirus vaccine became available for public distribution in December, and we're extremely proud that it was a CUNY nursing alumni, Sandra Lindsay, who was the first person in the US to receive the vaccine. Once vaccines became available, CUNY once again proved its importance to the fabric of our city as the university has made 5 of our campuses available to serve as vaccine centers. About 500,000 New Yorkers have been vaccinated at either Medgar Evers College, York College, City College, Lehman College, or Queensborough Community College. And more than 2,000 CUNY students were activated to help at vaccine centers across the city as these impressive future leaders rallied to help their fellow New Yorkers, even as they face unthinkable pressures and loss. Our amazing students continue to make our university and our city proud. Just last week, we learned that 3 CUNY Community College students were named as recipients of the highly selective Jan K. Cook Foundation Undergraduate Transfer Scholarship, honoring the nation's top community college students. CUNY Community College students also figure prominently in the Kaplan Education Foundation's most recent awards. At the same time, we're in the midst of a major transition in leadership that began with my appointment as chancellor 2 years ago this May. I have continued to assemble a cabinet and college presidents of unprecedented diversity who reflect the city we live in and the students we serve. The Board of Trustees has appointed 10 new presidents during my tenure, including our most recent appointment of Dr. Patricia Ramsey as president of Medgar Evers College, the first woman ever to serve in that role at Medgar. The appointments also include the first 2 Asian Americans ever to serve as CUNY College presidents, 4 women, and 4 African Americans. Looking ahead to life after COVID, we redouble our efforts to help our students succeed, graduate on time, and find sustainable career paths that would also help drive the state and the city's economic recovery. Among the most important developments were a plan to expand mental health services on our campuses and a new partnership, the New York Jobs CEO Council, which is working with the CEOs from 28 of the largest employers in the New York area to create a pipeline to job opportunities for 25,000 CUNY students. Additionally, CUNY is working with the Department of Youth and Community Development and the Center for Youth Employment to launch the CUNY Recovery Corps, a partnership to offer 5,000 CUNY students from targeted low-income and vulnerable populations the opportunity to participate in the Summer Youth Employment Program. Employment and job sites will be focused on helping with recovery efforts in the education, healthcare, community, nonprofit, and small business areas. CUNY launched its newest set of offerings for the CUNY Upskill Challenge that began 1 year ago to help students, alumni, and New Yorkers with free opportunities to train in areas that are highly demanded by employers. In addition to over 30 curated offerings from partners like Microsoft, Google, General Assembly, and Salesforce, we added CUNY courses to the mix through scholarships funded by a generous grant by the Bank of New York Mellon Foundation. We are offering over 1,300 scholarships for training at 9 colleges, and we'll be introducing 26 more training offerings this summer. We have funding through the U.S. Department of Education, and we'll be introducing new courses and programs through the year as the economy picks up and employment prospects improve. Finally, we are pleased to offer the Internship to Employment program this summer in partnership with several small businesses intermediaries through the Brooklyn Navy Yard and the Grand Central Tech to give recent CUNY graduates paid internships with at least half of the positions converting into full-time pay, professional positions in technology, marketing, and engineering roles. This is an important program for small business recovery, and we hope to scale it over the next year. Today, 100 students have taken part of this program. The fall 2021 semester is closely upon us. The well-being of every member of the university community continues to govern our decision-making in every respect. Rigorous reopening guidelines created by the central office and each CUNY campus last summer are being updated in consultation with university stakeholders, faculty, students, unions, for the fall of 2021. Earlier this month, Governor Cuomo announced that COVID-19 vaccinations would be required for all students attending in-person classes beginning this fall. With this in mind, I continue to strongly encourage every member of the CUNY family to get vaccinated. My office has made the careful decision to mark the week of August 2nd as the day for staff to return to their workplaces in preparation for a more in-person fall. Faculty will follow in accordance with the academic calendar of their campuses. The return to in-person work will be guided by the university's Safety First approach, which includes a blended scheduling system combining remote and in-person arrangements. Let me turn now to the mayor's executive budget proposal. While we are grateful for the funding of our mandatory cost increases, the budget also includes a $77 million efficiencies target in fiscal year 2022. A component of this efficiencies target included a $10 million reduction to the incredibly successful ASAP program, which has more than doubled community college graduation rates and is being replicated in several other states. We are pleased that the mayor's office has committed to rescind this cut to ASAP as part of the fiscal 22 adopted budget. With this adjustment, CUNY is left with a $67 million reduction, which is $21 million higher than what the city removed from the current year budget. If this reduction were enacted, CUNY's community colleges will experience a 12% cut in city support since the pandemic began. We also had to absorb a one-time $20 million reduction in the last quarter of fiscal 2020 when the coronavirus first began to negatively impact the city's finances. A reduction of this size will severely limit our community colleges' ability to provide the core sections and other vital supports that our students rely on in pursuit of their degrees. We also seek the council's help in restoring $1.7 million that was provided for remediation in the current fiscal year, $1 million for the Food Insecurity Initiative, $500,010 for our community college childcare centers, and $2.3 million for various centers and institutes in the fiscal 22 city budget. We're also requesting $7,500,000 investment for the Center of Ethnic, Racial, and Religious Understanding, CERU, an equity education center that works in both academic and community settings, providing impact-based, nonviolent communication tools for individuals and groups and helping them to bridge social differences. In addition to these reductions, the pandemic has caused other unprecedented stress on our finances. Specifically, the community college enrollment has been negatively impacted. In the current academic year, student full-time equivalent enrollment decreased by 14% from pre-COVID levels. This was a trend that was experienced statewide and nationwide at community colleges. As a result, the year-to-year tuition revenue loss to the community colleges is $42 million. The university has frozen tuition rates at its community colleges for 5 consecutive years. Let me repeat that. The university has frozen tuition rates at the community colleges for 5 consecutive years. We are also proud that 2/3 of our full-time undergraduate resident students attend tuition-free, thanks to the general's financial support, like the TAP program, Excelsior scholarships, and the City Council's Ballone Merit Scholarships. We are grateful to the City Council for continually securing resources for the Ballone Merit Scholarships. We will ask for advocacy again, as funding for this critical student support program was not included in the fiscal 22 executive budget. CUNY's budget request for fiscal 2022 takes into account our needs as well as the current fiscal environment. Our focus is on responding to the pandemic and jumpstarting New York's economic resurgence. Some of the initiatives for which we're seeking support include prioritizing student mental health, creating a nursing pipeline program, forging connections with private industry partners to create career pathways for students, expanding the successful CUNY course internship program, and enhancing diversity within our faculty full-time ranks. We're also seeking crucial capital budget supports to enhance our IT systems, the needs of which have come to the forefront during this pandemic times. Thanks to the continued support of the New York State and city partners, I am extremely optimistic of the future of this great university, despite the challenges we have collectively faced from the coronavirus. Having seen our administration, faculty, students, and staff pull together and lift one another, even as their families and communities were buffeted by profound difficulty and loss, it shows me that CUNY, like New York itself, will always persevere. I had never been prouder to be a member of the CUNY community or more certain of the integral role the university plays in the sustenance of New York City than I have ever been. This concludes my testimony, and I will now ask our Chief Financial Officer, Matt Sapienza, to provide more information on CUNY's capital budget. Thank you.
Good afternoon, Chairs Drum and Barron, and members of the New York City Council Committees on Finance and Higher Education. I am Matt Sapienza, Senior Vice Chancellor and Chief Financial Officer at the City University of New York. I'm grateful for the opportunity to testify this afternoon about the university's capital budget needs. You heard from our Chancellor regarding the challenges brought on by the coronavirus, and that also certainly applied to our capital program. Due to public health and financial constraints, the city stopped all construction early on in the pandemic, with the exception of priority health and safety projects. Over the past year, as more priority health and safety projects came up, we received individual approvals to proceed. We are pleased that the mayor's office has normalized the process and we are proceeding with business as usual, which means projects are restarting and new projects are being initiated once again. Despite the delayed start, the university is on target to complete 13 capital projects in fiscal year 2021 and an additional 23 in the next fiscal year. One of the key projects completed this year is the expansion of the CUNY in the Heights facility, with increased operations there due to begin in the fall semester. The capital plan outlined in our fiscal 22 budget request reflects two critical priorities in response to the pandemic. The first is a need for higher air quality standards, and the second is the recognition that we need to accelerate our IT improvement efforts. Designs for capital renewal projects will include new criteria to improve the indoor air quality for our buildings and the latest public health information to ensure the safety of our community. Regarding IT, the required pivot to distance learning has underscored the need for reliable, flexible, and user-friendly technologies. We must continue to improve and modernize our IT operations to be supportive of business needs and evolve our systems to adapt to the changing needs of our students, faculty, and staff. Moving to modern cloud solutions will help us to replace paper and manual business processes with digital workflows, and to centralize data that is currently located in systems managed by external providers. The city's executive budget proposes $615 million in capital funds for CUNY over the 5-year plan through fiscal year 2025, including $5.1 million in capital funding from the borough presidents. We have worked collaboratively with the Mayor's Office of Management and Budget to more accurately realign the 5-year plan with expected start and completion dates of capital projects. We are also pleased that the city's plan includes an agreement between CUNY and the School Construction Authority to build a new building on the campus of Medgar Evers College. The project will remove about 19 trailers which have been used as classrooms and replace them with a new building to be shared with the Department of Education. One of the most critical issues affecting CUNY's capital program is the age of its facilities. The university's facilities portfolio consists of 29 million square feet in 300 buildings across our 25 campuses. The average building at CUNY is more than 50 years old. Most are over 30 and some exceed 100. Capital construction, however, is a known strong economic engine to restart economies. CUNY has been a major part of that process for New York City. Investment in CUNY's capital program will create jobs for the local economy, resulting in an incredibly strong return on the city's investment. We are very grateful for the City Council's strong advocacy on behalf of CUNY and its students. We are now happy to respond to questions from the Finance and Higher Education Committees.
Thank you very much. And before we begin with questioning, let me say that we have been joined by Council Members Riley and Ulrich. Chancellor, it's always good to see you. I'm just trying to pull up my questions here. Okay. The expense budget. CUNY has a total proposed budget of $1.19 billion for fiscal 22. What is the estimated cost of the COVID-19 pandemic on the university system? And how did CUNY measure this cost? And does it account for the learning and achievement losses as well?
So thank you for the question, Chair Drum. Let me take one part and allow our Chief Financial Officer to talk about the financial cost. We have a page in the CUNY website called In Memoriam, in which we have listed all the loss of lives that we've had from faculty, staff, alumni, students, and always in consultation with their families for privacy, of course, for them to be included. And so there's a loss there of talent, there's a loss there of vitality, which is very difficult to quantify in any way. And we hope to be able to, as we can gather together in person, find a way to also celebrate those lives. So, I mean, that is one element of loss. We're also working with the students that did not adapt as well to the online instruction to help them stay in course for graduation. And let me now turn to Matt for the financial calculation of the loss.
Thank you, Chancellor. Thank you, Chair Drum. So in terms of the financial loss, we have three main funding sources at the university: State of New York, City of New York, and tuition. So I'll talk about all three. And also point out that since the beginning of the pandemic, since the onset in March 2020, our colleges and the central office have incurred about $75 million in unplanned expenses as a result of the pandemic. 75 million of things that weren't in our financial plan prior to the pandemic that we've now expended since March of 2020. In terms of the funding sources on the state side, in the current year, we had a $38 million reduction, 26 at the senior colleges and 12 at the community colleges. We're very grateful that the state budget does not include those reductions for fiscal 22. It's just a one-time reduction. On the city side, as the chancellor mentioned in his testimony, we had a $20 million reduction in the last quarter of fiscal 20 that we absorbed, and a $46 million reduction in the current year that is proposed in the mayor's executive budget to grow to $67 million on the city side. And then lastly, tuition revenue. As the chancellor mentioned in his testimony, our community college enrollment was down 14% as a result of the pandemic, which resulted in a tuition revenue loss of $42 million year to year from fiscal 20 to fiscal 21. So certainly an extremely negative impact on our community colleges. So, all three of our funding sources were significantly impacted by the result of the pandemic, and as well as we had unplanned expenses of up to $75 million to incur.
Just can you elaborate a little bit more on what the 75 million, I think you said it was, losses due to the pandemic? Where were those where did that happen?
Yeah, no, it's interesting. Very early on in the pandemic, when we were finding out that students or faculty were infected with the virus before we went to distance learning, we were expending money on cleaning companies to come in and disinfect the buildings where these people had been. And then once we went to distance learning, the costs were various things like buying PPEs, buying hand sanitizer. One of the most significant expenditures that we had that we were really grateful about is we purchased, as the chancellor mentioned, 33,000 iPads and laptops that we gave out to students last spring semester to help them with the transition to distance learning. We bought about 4,000 personal hotspots for students as well, to help those students who their Wi-Fi isn't as strong as in other parts of the city. So we were pleased about that. And then one last thing I'll mention, just, it's kind of a large category, is we also incurred expenses for professional development for our faculty, a lot of which was run through our School of Professional Studies, again, to help faculty be prepared for the transition to distance learning this past academic year.
Let's just talk a little bit about the stimulus funding. Federal guidelines on the distribution of COVID-19 stimulus funds have been lifted, allowing for funding to be issued to undocumented students. What is the total amount in aid that will be dispersed to CUNY's undocumented students, and how will the funds be distributed?
So you are absolutely correct. In the first CARES Act, undocumented students were not included in the previous administration's very narrow definition. And that's one of the reasons why we established the Chancellor's fund, because that allows to sort of support those students with private dollars. So a lot of it, a significant amount of the funding of that first 10 million that we raised went to undocumented and international students that were not included in the CARES Act. They were included as part of this last allocation of 118 million that we got from CRESA. We had planned for that. We had hoped that the administration would change the policy, and they did. So they're included in the funds that we just began dispersing about 2 weeks ago. And when in the fall, we dispersed the funds from the ARPA, the last stimulus funding signed by President Biden, they will be included too.
Do you have the amounts on that, Chancellor?
Matt, undocumented exclusively?
Yeah. Yes.
We don't have that yet, Chair Drum. We certainly were, so pleased with the announcement last week from the U.S. Department of Ed that these students were now going to be eligible. And so we are now working towards getting them the awards, as the Chancellor said. So we'll have better data within the next couple of weeks. Undocumented is always very tricky because it's not a question that we ask of students, are you undocumented? Because we are trying to be protective of that group. But we're doing outreach and through our campuses, and we'll have some better data on that within the next several weeks.
Do you have an estimate of how many undocumented students you might have either in and the junior colleges and in the senior colleges?
So when we did the reach out campaign with the Chancellor's Emergency Fund, because they were excluded from the CARES Act, it was about 5,000 students roughly that responded.
Thank you, Chancellor. And what are you doing to reduce the learning loss experienced by students, and what additional resources are being allocated to support your students' needs?
So we've been very, very focused on that. I think that our university provost has been the point person there in collaborating with the DOE to get ready for the students that are coming our way and to monitor the transition when we move from, to almost totally in person to mostly online. So let me allow our university provost, Luis Cruz, to comment on that.
Thank you, Chancellor. So as the Chancellor indicated, CUNY has been working with the Department of Education on a series of summer bridge programs as we look towards the fall to ensure that we address some of that learning loss. As well, we have our campuses getting ready, preparing for the incoming class to make sure that the usual orientations and support services that are available recognize this reality.
Thank you. What is the university's plan for reopening the campuses to in-person learning this fall?
So thank you for that question. We are, and clearly the the governor's announcement on the mandatory vaccination for students, and we're sort of getting ready to provide sort of the policy, right? Have the board vote on a policy around that. Clearly has. I mean, there's a lot of questions, right, before that as to whether we're going to be requiring or not for students. What we're trying to do is to really meet the students where they are. We have students who are hungry for that in-person experience because they didn't have it at CUNY or at the DOE for the past year and a half, or they want a more hybrid kind of blended experience. So we want to be able to have abundant courses for those students. Now that it's becoming clearer that with the vaccine and several other precautions, we can safely gather in our campuses. But we also learned that a lot of students enjoy the flexibility that online provided. Many of our working students that have to balance work schedules, many of our student parents that have to balance taking care of their children, have enjoyed the flexibility of online. So what we're trying to do is to have a very robust set of offerings that has all that menu. And then we meet you where you are. If you think you learn better and you're more comfortable with an online and a hybrid, to have those courses for you. If you're hungry for that in person, we want to have those courses there for you, and letting the demand from the students tell us where the courses need to be. The other thing that we have done, Chairman Drum, is a really historic investment in the professional development of our faculty. And I know that both you and Chair Barron care about pedagogy and teaching. And we have provided professional development for over 4,000 of our faculty members so they can teach better online, right? So they can be better adapted to support our students in that modality. We needed to do that during this pandemic, but we also think that that's a great investment moving forward in terms of the improvement in the pedagogy for the entire system moving forward.
Thank you, Chancellor. The university did not reappoint approximately 2,800 adjuncts and part-time workers at the start of fiscal 21. Will the university rehire these positions in the fall? And if so, how many teachers would be rehired?
So again, that was, one of the very difficult decisions that we faced, last year, where we were dealing with a number of decisions that we never thought that we would need to do given the fiscal crisis. The reappointment of the adjuncts will be based on the final budget, which we're going to take to our board for a vote in June, and enrollment trends. I mean, those are the two factors that drive the reappointment of adjuncts. I will say that I'm very proud that last year, even with some of those difficult things, working with the PSC, we protected about 80% of the adjuncts that had health insurance during our joint efforts. And I personally went out and sought private dollars. Thanks to the Mellon Foundation, we're able to rehire 653 of those adjuncts, mostly in the humanities. So we value the adjuncts. And the one thing that I'll say is that I think that we all are looking for a university where we depend less on adjuncts and we have more full-time faculty. We all can embrace that. The best way to do that is to provide recurrent tax levy dollars to our university. The way that we can hire people full-time is if we know that they're part of our baseline budget, not on money, which is one base and non-recurrent. So that would be the best way to support that would be to help us with that $67 billion budget gap that we have that would allow us to hire more full-time faculty and therefore hopefully hire some of those adjuncts as full-timers.
And just for my own clarification, who makes that determination about, I'm losing my thought here now, about
the hiring?
Yeah.
So
no, about baselining.
Well, I mean, I was making a reference to recurring funding coming from the city and the state, right?
Okay.
That would allow us to then, to bring more full-time folks that then would require less part-time adjuncts, and hopefully have some of those adjuncts with teaching experience in those positions.
Okay, I got it. Thank you. I want to talk about one of my favorite projects, and that's the LGBTQ Public History Project at LaGuardia Community College. Richard Lieberman and the folks there have done an incredible job with it, and with a little bit of funding, a minimal amount of funding. In fiscal 21, the LGBTQ Public History Project at LaGuardia College was funded at $250,000, providing students from the CUNY Queens campuses with its third year of LGBTQ plus focused programs, activities, and events. Are there any plans to replicate this model on the other CUNY campuses? And if so, how much additional funding would be needed to expand this work in fiscal 2022?
So thank you. From a fan to a fan, I was able to see how transformative that those funds were to the students in the entire borough, but particularly to the students when I was at Queens. We had an exhibit in our student union that you attended the opening. We were able to do a CUNY Pride event for the entire borough thanks to that. What we would like to do is to be able to calculate and come back to you with a number. Since I have some first-time experience on how beneficial it was, I like to be able to guide the staff as they think about what would this look like if we did something CUNY-wide, and what would the cost be, and we'll be happy to come back to you with that, because it's been really transformative for the campuses and the students, and I commend you for being a driving force supporting that.
Thank you, Chancellor. And I think you're absolutely right in terms of how transformative it's been, not just for students, but for faculty members as well. The last exhibit that LaGuardia did focused a lot on faculty members who shared their own coming out stories, many of whom had not even been out to their colleagues prior to that at the LaGuardia campus. And it's been done on the other campuses as well. And it's really been a uniting thing, a unifying thing across all the Queens campuses. And certainly I would love to see it expanded. So appreciate you getting back to me with some figures on that, and see what we can do together to replicate that.
Absolutely.
Thank you. Okay, I'm going to turn it over to my co-chair, Councilmember Barron. She needs to be unmuted. There we go.
Thank you so much. Thank you, Mr. Chancellor, and your team for coming to answer our questions. I've got lots of questions. I'm going to start with ASAP. So in your testimony, you referenced the fact that it's been announced that ASAP will be returning. What kind of commitment do we have that that will in fact happen? And that question is based on the fact that we're very cautious about any outward agreement until we see it included in the budget. Because we know last year it was restored at adoption and it was included, but an additional $20 million cut for the count that the council was not privy to was implemented. So it was like a sleight of hand, you know, give on one hand, take even more on the other. That's really disingenuous. I think it's very dishonest. And what do we know we can expect in reality without snitching or taking it from another part?
Well, so I couldn't agree more about the importance of ASAP and keeping it whole. As you mentioned, it has shown incredible results in our community colleges in terms of graduation rates and retention, which then also becomes a feeder to our four-year institutions, right? So I've always argued that ASAP is a wonderful recruitment tool. It's a great way to have students succeed and graduate. So when we made the argument to the mayor's team, we say that 10 million cut is a larger cut because you are cutting down our capacity to recruit. You are hurting our enrollment, which goes to the bottom line. And by hitting a program that has such dramatic graduation results, you're also hitting enrollment in the four-year schools in the future, right? So it's a hit that multiplies. So we are hopeful that money will be restored and that there be no other sort of shifts of funds that would affect ASAP.
Great. So that's what we're looking to see also. We're going to be looking at this budget very critically because it was disingenuous and it was, I'll just leave it at that nicer word, disingenuous, to do that. And now in terms of the remediation restoration, we wanted to baseline the program, but we know how important that remediation program is because of the deficiencies that students have when they are graduating. And we wanted to have it baseline. So what has your conversation been with OMB about the restoration for fiscal 2022 for the remediation program?
So Matt, do you want to take that on the OMB? And I'm happy also to have Provost Cruz, if you want, talk about the academic side.
Thank you. And if I could ask if you could be succinct because we're a little behind schedule, which is very important, but we can get the crux of the answer on. Thank you.
Thank you, Chair Barron. And yeah, we were, disappointed that the funding for the remediation was not included in the executive budget. One thing I want to point out about the remediation that's really important is that it was funded in the current fiscal year, fiscal 21, at 1.7 million. Right. But that was a reduction from prior years. Right. In prior years, it was funded at 2 million. So we are certainly advocating for the restoration back at the original 2 million amount. Okay. And that's what we're here to ask for your help with today.
Thank you. And in my opening statement, I referenced Hunter College High School. Why did the president of Hunter College Campus School not employ the same policy as the CUNY system and suspend standardized testing, the SAT and the ACT for CUNY requirements for admission? And how do you believe that this suspension is going to affect the level of remediation for incoming freshmen? And also in terms of our stated goal of trying to have, quote, diversity, how does this decision on behalf of the president, made by the president, not on behalf of, but made by the president, match up with our claims for wanting to be a diverse institution?
Well, I mean, I'll say two things about that. And I think that I concur with you that we wish that we had the results from the task force that they put together that has students, faculty, and some of the community members sort of thinking about, what should be the admissions criteria and how to make it operational moving forward. And I think everybody wished that we've had that blueprint earlier so that we could put it in place this year. And one of the things that we say is that really needs to be done quickly so that, we don't waste time next year and we can have it, analyze it, embrace it, and then get it ready. For this year, there's some things that are different in the way that it's been done in the past. The exam is being given in all the outer boroughs, not just in Manhattan, sort of making it easier for many, many more students to participate. There's been a lot more recruitment directly in schools that have large, diverse populations, hoping that pipeline increases too, and additional support in terms of exam preparation for individuals outside of the borough of Manhattan. So we believe that those things will bring a more diverse class. Clearly, that is not the long-term answer. And I'm looking forward to the solutions that come from this group, which is immersed in the Hunter community, to bring those changes next year.
Thank you. With all due respect, Chancellor, this is not a new problem. It's been a long-standing problem. There's been a steady decline. And to know at least 15 months ago that now was an opportunity to seize this time to resolve the issue and to not do that in a timely fashion, I think is very revealing in terms of not taking advantage of the opportunity, the climate, the culture to get a resolution. So I want that to be very strongly reflected. This is not a new problem. It's not a new problem. It's been a steady decline in Black and Brown. And now here at the same moment, we don't come up with a plan. We're doing more of the same. We're doing wider population. We're going to do some test prep. We're going to increase the pool, but you're using the same criteria, a standardized test, which historically we know to have been racially discriminatory. So moving on to my next question. We did not, we looked at the, in your testimony, you referred to the laptops, the $33,000 that was spent on laptops. Was that out of expense or was that out of capital?
I will let Matt.
Sorry, Chancellor. Yes, that was fully expended out of the capital budget, Chair Barron.
It was out of the capital budget, okay. When we last left CUNY at the fiscal 2022 preliminary budget hearing, we had some outstanding questions, which also pertain to the executive budget. For CUNY had no new federal stimulus aid added to its community college budget in that plan. We need CUNY to clearly walk us through the federal stimulus aid received in the community college budget in fiscal 2021. Our records reflect that just $39.3 million from the CARES Act grants has been allocated to the community college's budget. Is that correct?
That's correct. 39.3 is the amount that has been allocated. We will probably use a little bit more in the current fiscal year for the community colleges. We're projecting about 43.9. So we will need about a $4.5 million adjustment made either in the adopted budget or when we close. But we're working through those numbers now, but we expect a slight adjustment will be needed in the current year for to recognize federal stimulus funds.
Why do we not see this funding included in the executive budget for the community colleges?
Yeah, Chair Brown, we have been talking to the Office of Management and Budget about this and about the need to include an amount for federal stimulus funds in the fiscal 22 adopted budget. And so that's the plan right now is to include that.
Which plan?
I'm sorry, Chair Brown. So,
expect to see that in? And for which
yes, in the fiscal 22 adopted budget, we are working with the administration and with OMB to have the appropriate amount of federal stimulus funds that we're planning to use for community colleges in fiscal 22 in the 22 city adopted budget.
Okay, and what is the $12.6 million year-to-date expenses accounting for exactly?
The 12.6 in expenses are for the things that I mentioned earlier: PPEs, hand sanitizer, IT equipment for the students that were bought outside of the capital appropriation, faculty development, professional development of our faculty for distance learning. And also one of the things that I didn't mention earlier, which I would like to, because it was a really important initiative and our chancellor and our provost very strongly supported it, which is we allocated funds for mental health support for our students as well. So all of that is part of the year-to-date expenses, and we can provide a detailed breakdown of that 12.6 if you'd like. So
yes, I would. Thank you. And so now the table that you had shared with us, with this body, you had a CARES category, HEERF2, and you had student awards, year-to-date expenses, revenue losses, and additional eligible expenses. Isn't that, in fact, to be reflected in the CARES Act for 2021?
Well, the HERF2, yeah, I'm sorry, Shubham. The HERF2 refers to the second stimulus allocation, which was the CRRSA. So those funds, we will likely use some of those funds in fiscal 21, but the bulk of those funds are going to be used in fiscal 22. And then HERF3 is the American Rescue Plan Act, which was announced by President Biden back in March. And again, those funds, a good chunk of those funds will be used in fiscal 22 as well.
And what is the $800,000 in additional revenue and tuition losses connected to exactly?
We wanted to set aside an amount for the colleges because when we were putting those numbers together, we had a projection of what the tuition revenue losses were from enrollment, and we had a projection of what the eligible expenses were that our colleges were incurring, but we wanted to make sure that we provided some additional funds there in case there were additional enrollment losses between now and the end of the semester, or there was an unanticipated expense. So that 800,000 was a really a projected amount of what may be needed. And as we get closer to the fiscal year end, we will have an accounting of that. One thing about the federal stimulus funds.
I'm going to jump to the next question because
Sure.
Thank you so much. I appreciate your understanding.
I understand.
Putting forth a proposal to its Board of Trustees on June 1st, 2021 for its plans to spend down an additional $176.7 million from CRRSA. All of this stimulus funding will support the community colleges, is that correct? And if so, how do you plan to allocate these funds?
So all of our colleges, the four-year colleges, the community colleges are all receiving stimulus funds.
Right, but I'm talking for CRRSA.
Yeah, for CRRSA, there were allocations to both the senior colleges and the community colleges. And as you said, Chair Barron, we have our Board of Trustees Fiscal Committee meeting on June 7th, at which we'll be presenting our proposed budget allocations for next year. And included in that will be a proposal on the allocation of the federal stimulus funds.
So that 176 million, is that dedicated for community colleges? 176.7 million.
176.7 million is the number for community colleges from CRRSA. But one very important thing I just want to point out on that is 39.5 of that is going for student emergency grants. That's part of the funding that we've been giving out to students over the last couple of weeks. So
that's just for community college students or for all?
That's just for community college students. So the remainder for institutional needs, net of the student emergency grants, is more like $137 million.
And will that be in the adopted budget for fiscal 2022?
Once we make our allocation, present our proposal to the Board of Trustees, and they hopefully will approve it, then we'll have a better sense of what the number is. But yes, it should be around that number. And again, one of the concerns there is with the $67 million cut we have from the city and the 42 we had in enrollment loss, that's 109 million right there. So it's using up a good chunk of the CRRSA funds, and that's why we're looking for restoration of that 67 million.
In addition, CUNY will receive funding from the American Rescue Plan as well. Is that correct?
That's correct.
And what is CUNY's understanding or analysis of what this grant will total for the community colleges? And when do you expect to see the funding added to the budget?
So this is pretty recent information because within the last couple of weeks, the federal U.S. Department of Education has provided the numbers to colleges throughout the country. So for our community colleges, they'll be receiving about $295 million from the American Rescue Plan. About $148 million of that $295 will go for student emergency grants. That was a requirement of the U.S. Department of Ed. They gave every single college a number that has to be the minimum number for student emergency grants. So that leaves about $147 million for institutional needs from the American Rescue Plan for the CUNY community colleges.
Okay. The committee.
Madam Chair, can I?
Yes.
Just one element of the part of the money that is destined to the students, it goes directly to the students, right? So we don't have no end, but I think it's an important thing, and I would hope that all the council members present help us let us know that funding, for the student will be providing it in the fall, right? So if I'm a student thinking about my plans for the future, right, I think it's important to let people know that we'll be giving additional stimulus grants in the fall semester, in which new and continuing students who are eligible, who meet the criteria, will be able to receive those supports. So that we're hoping is also another reason to encourage enrollment, and we would love the support of the council in letting people know about this.
Great, thank you.
Thank
This
you.
committee wants to understand clearly how and where CUNY might be restoring any cuts that the university received in the November and preliminary plan from stimulus aid. Some of these cuts are true efficiencies and pandemic-related savings. So while we want to see CUNY fully funded, on balance, we want to ensure that the CTL is being allocated and spent down as precisely as possible to avoid waste. So efficiencies are good. So of the cuts that were taken from both the November and preliminary plan, which are CUNY's priorities to restore?
The biggest priority right now, Chair Barron, is the operating aid for the community colleges. We're very concerned about the community colleges. All of the programs that we've mentioned earlier, remediation, so important, our child care centers funding, so important. They're all critical, but we're very concerned about the community college operating budgets, not only because of the $67 million proposed reduction, but also, as we've mentioned, the enrollment losses. And obviously, we're hoping to get students back in to our community colleges, but the combination of both of those things is creating a situation at the community colleges that, again, we don't want all of the federal stimulus funds to go to plug a hole. We want those federal stimulus funds to be used so we can invest in our students at the community colleges and invest in our campuses.
Thank you. Additionally, what is CUNY's plan to invest the stimulus funds into the university system, specifically the community colleges? We know that CUNY applied $5 million from the CARES Act toward mental health resources, and we understand the application and the need for that. Is CUNY going to invest more funds for mental health services? And if so, how much will be invested across the community colleges?
Yeah, that's the plan we're working on now that we're putting together to present to our Board of Trustees in a couple of weeks. And it is our intention to have additional supports for mental health services for our students as part of that plan. We're also pleased in the state budget, we received an additional $1 million for mental health support. So yes, it's our anticipation that will be part of the plan. We don't have the numbers worked out yet, but mental health is an important initiative for us at all of our colleges, including the community colleges.
Yes. At the mayor's briefing on the fiscal 2022 executive budget on April 26th, the mayor stated that CUNY is receiving $800 million in federal stimulus funding. Is that the same total that you are accounting for?
Yes, and the numbers we were talking about earlier for the community colleges are a subset of that total.
Okay.
And the rest of it goes to our four-year schools and our graduate and professional schools. And as the chancellor pointed out, about half of that is going for student emergency grants.
Thank you. So it's 500 in stimulus that's a part of a larger number, or is that the 500 million? Is that the total?
The total for the American Rescue Plan is a little under 800 million. It's like 798 million, something like that.
For the system.
For the whole system, for all of the colleges, including the community colleges.
For all, including, okay.
Mm-hmm.
So to recap, how much federal stimulus funding has CUNY received in its budget for the community colleges in fiscal 2021?
Fiscal 21 right now, the revenue that's been recognized is 39 million for the community colleges. And like I said, we'll need a small uptick to that when the adopted budget is done for the current year, probably about $4.5 million increase. And then we'll need an amount recognized for fiscal 22, as we mentioned earlier.
How much more federal aid does CUNY know now that it will receive in fiscal 2021, and also how much for fiscal 2022?
Fiscal 21, the first round of stimulus CARES Act, we are going to, for the community colleges, we are going to fully utilize the CARES Act money by the end of the fiscal year. That money will be fully expended. We will use some of the CRISA money in fiscal 21 for the community colleges, and then the balance in fiscal 22. And we're beginning to develop a plan for the American Rescue Plan Act funds as well. So some of that will be expended in fiscal 22 as well. So that's all part of the budget proposal that we're putting together for our Board of Trustees.
And I'm almost finished. I have a few more questions. Thank you for your answers. The executive plan includes a large revenue adjustment totaling a reduction of $56.5 million in fiscal 2021. It would be good to hear more from CUNY, and I know we began touching on this subject during our preliminary budget hearing, and at that time we were discussing an approximate $40 million drop. So some of this total revenue adjustment is being rolled from the previous fiscal year. Is that correct? And if so, please explain this to us.
Yes, Chair Barron, the $56 million adjustment was an adjustment to the plan that existed in the city's financial plan for CUNY tuition revenues. So we had to bring the plan down by $56 million. The $42 million refers to just the year-to-year change in the total amount we collected in tuition revenue in fiscal 20 versus what we're projecting to collect in fiscal 21. So that's where the $42 million, that's what the $42 million number represents. $56 million was the adjustment to the plan. So the plan was a little higher than it should be. Even if our enrollment had remained flat, we would probably have to bring the plan down a little bit by 14 million or so.
So is CUNY self-funding this shortfall this year?
That 42 million, the federal stimulus funds are going to fill that shortfall for the current year, which we're grateful for to have the federal stimulus funds for that purpose. But we're certainly hoping that our enrollment bounces back so that we don't need to use federal stimulus to fill that gap and instead can use it for investment.
And what is the exact total tuition shortfall to CUNY for fiscal 2021 only?
For the community colleges, fiscal 21 only, the year-to-year decline in tuition revenues was $42 million.
And how many students were enrolled in the fall and then in the spring?
I think I might
refer that to our I think there was we can send you some of the numbers so you can have the correct numbers, but there was a decline in the community college sector, which is our biggest concern.
Okay, great. And so to confirm, the state's enacted budget is holding the community colleges harmless from under enrollment and has increased the base aid support by $50 per student, generating an additional $4.2 million in fiscal 2022. Is that correct?
That's correct. And we're very grateful for that base aid increase and for the hold harmless as well. Very helpful to our community colleges.
And were there any cuts imposed by the state to the community colleges budget for fiscal 2022?
There were not for 22. For 21, yes, but no cuts for the community colleges for 22.
Okay, and will CUNY propose to its Board of Trustees any kind of increases? You know my position on increases about tuition. You know, it's my position that CUNY should be tuition free. It's my position that at least the first 2 years post secondary school should be a part of mandatory education provided by the state, either at an institution or a trade school. So my position is that there should not be any increase, there should not be any tuition at all. But are you proposing that?
You'll be happy to hear there's no tuition increase in the budget for next year.
Okay, great. Thank you. And I have more questions, but I'm going to turn it back to the chair. I know we have, and if there are other questions that I may not be able to present to you at this time, the staff will send them to you so that you can respond in writing.
Delighted to. The door is always open. Thank you.
Thank you, Mr. Chair.
Thank you, Chair Barron. We do have questions. We have one from Councilmember Lander.
Yes. Thank you very much. Sorry, let me move to a location where I can ask my questions. All right, thank you very much, Chair Drum and Chair Barron and Chancellor. It's good to be here with you. Thank you. Obviously, CUNY at this moment coming out of the pandemic is of just extraordinary importance to New York City, and we need to do everything we can to support and invest in it. So I'm going to be fighting very hard, to make sure that we increase the funding for CUNY. I was not happy to see in the executive budget that while we're increasing funding for the NYPD, almost $190 million, that we're cutting some significant critical funds for CUNY. So I will be joining both chairs and everyone in fighting to make sure that we increase the budget just this year. Last year, we had a really interesting conversation in this committee under Chair Barron talking about the possibility of moving to some kind of pilot program where institutions like Columbia and NYU would provide funding where they don't have to pay their real estate taxes, that could be a dedicated stream of revenue to CUNY. I'm not going to ask you about that today, but I think as we come to the other side of the pandemic, Chair Barron, I know this is something you've spoken about. I want to work hard to make sure we fight together for some long-term resources. Obviously, American Rescue Plan funding is valuable, but we need new long-term resources for CUNY if we're going to sustain it for the long term. And I think, I hope that that pilot idea could be a way of getting that done. But I do want to follow up on Chair Barron's questions about Hunter College High School, because I have to say, I just was extremely distressed about this. I asked your representatives about it during the preliminary budget hearing and was promised answers sooner than they came. And then when they did come, they were really unacceptable answers, both the way we found out and the idea that there wasn't enough time is just utterly false. All around the country, Boston Latin changed theirs. In almost every other place, selective high schools with a single test, one school, were able to change their approach for this pandemic year. May not be the same thing they're going to do for the long term, but that doesn't mean this year was precisely the year to make those changes. And to refuse to make them, I guess my first question is this: do you think the Hunter College High School test, the way it's constructed, is consistent with the values of CUNY?
Well, thank you for your support regarding our budget and our budget needs and sustained funding. So appreciate that and happy to provide any information as you develop pilots and things of that nature. Regarding your question about the Hunter College, I think that we have that group that involves students, faculty, alumni, members of the Hunter community that are going to provide sort of a new path forward. And I'd like to sort of wait to hear the recommendations as they think about the different options for the school.
So I hear you. I guess I want to start by saying the current approach to admissions at Hunter College High School is not consistent with the values of CUNY, and that is an important starting point. Like, setting up a long-term working group is fine, but then using it as cover to keep the test this year. And don't forget, those other selective high schools around the country, they're not grounded in a public institution like CUNY that has values of equal inclusion and genuine social upward mobility. So it is important. And I believe that you should be saying to President Raab, your working group is good, but your approach is inconsistent with CUNY's values. It must be changed. And I'm asking you to do that because I think you've got to be political too, but I think it is inconsistent with CUNY values, and it is appropriate for you as Chancellor to tell President Raab and the Hunter community they must make this change. So, but I want to ask two budget questions about the money we're giving Hunter College High School. So these two questions. First, how much of the money that the City Council is providing for Hunter College High School is going to administer, develop, provide outreach for the test? And second, I've been told that of the $18.9 million that Hunter College High School is getting in your allocation, that $900,000 of it is not even for Hunter College High School, that it goes to other Hunter College elements that should not really be funded, through city funding. So can you tell me about those two things?
So I'll have Matt take the second part of the question. I think the first one is one that I don't think that we have the information available because that plan is being developed, but I'll get you the information about the cost of the plan. And then for the second part, let me defer to Matt.
Thanks, Chancellor. And yeah, Councilmember Lander, I'm not aware of any amount of $900,000 that's being diverted to other Hunter needs. Perhaps what it could be is that Hunter College does provide services to the high schools for security and IT and other things. And so it could be part of that, but we'll look further into that. And as far as we're aware, the entire city allocation is going to the Hunter campus schools.
So I'd like you to get back to me about this, because I'm told that $900,000 goes for some payroll administration and a range of things in Hunter College that are not connected to the high school. And I really do want to know what that test is costing, because I got to be honest, and I'm going to talk to the chair about this. I'm so angry about the way that President Raab and Hunter College High School have approached this opportunity that I think the council should consider not, moving that $900,000 and the cost of the test to other CUNY elements. I don't want to cut CUNY. All these things we're talking about in this hearing need funding. And if Hunter College High School is not going to move to an inclusive admission system when everyone else in their position is, then we should use those resources for the other critical CUNY needs that genuinely provide inclusive education, real social uplift. So I will appreciate your getting back to me and to the chair about those matters.
Thank you, Councilman Lander.
Thank you.
We now hear from Councilmember Rosenthal.
Time starts now.
Thank you very much, Chancellor. Always great to see you and your staff. Thank you for being here. And thank you, Chairs Drum and Barron, for your terrific questions. There's not much left over. But I want to raise 2 points. One is, and I may have missed this, so my apologies. But where are you with opening up the Child Care Center? I understand the reduction in funding for this past year with the colleges closed, but how about for this year now that you're opening up?
So let me ask our university provost, Jose Luis Cruz, to answer that, because I think he has more updated info on the whole childcare scenario.
Thank you. You're on mute.
Thank you. I needed permission to unmute. So thank you for the question. All 16 childcare programs across the system are currently open for either remote service or in-person service, depending on each of the campuses. At the end of March, we had about 629 children, about a 28% increase since January. So we're slowly coming back up. And the Child Care Center in City College in particular, that I know has been of interest, will be opening up in August.
Oh, that's great. That's great. But didn't the child centers take $150,000 hit in the budget? Or am I mistaken about that?
We have I'm sorry, Councilmember.
No, go ahead, man. Restorations, yes.
I'm sorry. Yes, we are looking for $510,000 that the council provided.
It was dyslexia thing.
No. There's a lot of numbers. $510,000 that was provided in fiscal 21 is not included in the mayor's executive budget for 22. And so we're looking for the council's help again on restoring that.
Thank you for that clarification. And I'm glad to hear that the child care centers are up and going. My second question is more obvious, and I'm sure Councilmember Drum got to this, but of the, OMB has a line, right, in the CUNY budget that says savings of whatever, 67 million, because they restored some ASAP. Did you already review the trail to your savings?
My sense was, and I'll let Matt, who's the budget person, right, be safe, that it was part of one of the questions that Chair Barron included in her questions. But I could be mixing apples and oranges. So Matt, I want to make sure that we're responsive to Councilwoman Rosenthal.
Thank you so much, Chancellor. And Chair Barron, feel free to jump in. I guess my question specifically would be, I get making the cuts. We're all going to fight to get that money back. But were there any efficiencies that you could take, and what are those?
Yeah, no, there certainly was. Early on in the pandemic, the chancellor announced a university-wide hiring freeze. And so we've had savings from that.
And by that, you mean accruals, but are they fully budgeted for the next year? Or did you take those positions out permanently?
Wait, the positions will be, if the cuts remain, the positions will be coming out. So in the city's plan, our intent is we're hoping that funds will be restored and that we can backfill a lot of these positions. Some of them are just vacant positions that haven't been filled. So
Wait,
we're
if
hopeful.
you could differentiate those two when you send follow-up information,
Yes.
I'd like to know how many have been vacant for the last, I don't know, you tell me, 5 years, and how many are, you're eager to hire to backfill the positions. So sort of those two categories, number of people in dollars would be helpful. Sorry, and I interrupted you.
No, we'll provide that breakout.
But I interrupted you.
No. Well, other savings that we've had, certainly on the OTPS side, travel was restricted as a result of the pandemic. People, going on conferences, professional development, other travel, and energy savings. We've had some significant energy savings from going to distance learning as well.
Thank you. 2 more questions, Chair, if it's okay. The actual savings from accruals and energy efficiencies and lack of travel what's the dollar value of that?
We'll get you that breakout. The significant savings are coming from not backfilling positions at this point, and energy with us moving away from distance learning, that's going to go away, but we'll get you the breakout of all of the
again, I'm more interested in just sort of the things that you can take that are no-brainers.
Yep.
Right.
Understood.
Okay.
Understood.
Thank you. Last question is about period poverty. Just before the pandemic broke, we were in good conversations, I think, with your office, Chancellor, about providing tampons at all campuses. And I know there's a wonderful company, I'm forgetting the name, but it's very clever, but where they're, you could have free, people could just get tampons. So where are you in that as you open back up?
So again, we had estimates for some of those costs, which is also one of the things that was a high priority for student leaders, right? It came out also from there. And obviously with minimal presence of folks on the campuses, some of those things have been derailed. And it's one of the things that we need to pick back up in terms of cost and operationalizing it.
Yeah, that's what I'm asking.
So again, it's not something that we have picked up recently. We've been candidly, trying to get people vaccinated and getting campuses sort of, ready. But we look into it and sort of reactivate it.
Okay, I'm not going to get graphic. I'm going to control myself, but it's a priority for your female students. You should know that. There's a reason that the student leaders took that issue up. And I would really like that information, rolling that out, your timetable, cost, where you're rolling it out, what you're doing. I think the Committee on Women and Gender Equity would be super interested in that. And just so the public knows, Dharma Diaz, the chair, is nodding her head, interested. So is that
absolutely
possible?
Absolutely. No need to be graphic. It is something that we had on the pipeline. I think that we can all agree that it's been a complicated year and a half, and we are now sort of getting back to some of the things that we had on the pipeline, and we certainly prioritize taking a look at that. Absolutely.
Last question, Chair Drum. I feel it. I this last. I promise. Then have you been distributing tampons at pantries?
I do not know the answer to that, but we'll find out because we have kept the pantries. And my sense is that our student support teams in the campuses have been very creative in trying to meet the students where they are. So I mean, I wouldn't be surprised that if it occurred to you and others, that probably we have been doing in some, but we can check, and clearly is something easy to implement because that is up and running now.
Exactly, and I think your controller was shaking his head. No, it's not done. But
no, I was shaking my head. I don't know the answer. We'll have to find out.
Okay, so 50%, 52% of your students need them. Thank you very much. Thank you, chairs, for the indulgence.
We will now hear from Councilmember Powers.
Time starts now.
Hi there, everyone. Sorry, I'm a late addition here, but I'm going to keep it really quick. First of all, I just want to add in, I don't agree with the previous statement here to pull $1 million from a high school in my district. So I want to be clear and on the record that any attempt to try to pull funding, I really agree with the goals, but I agree pull funding from Hunter High School in my district. I just don't agree with that, and I want to be on the record about that. I just had one quick question. I'm sorry if you guys touched upon this already, and I'm sure you did, but I just wanted to hear the CUNY's plans for the fall when it comes to remote learning or versus fully opened in-person learning. And I'm sorry if you already already answered that, but just for behalf of some of the schools in my district, wanted to hear what the latest was when it comes to what CUNY will be doing for in-person learning and remote learning in the fall.
So thank you for your question. So the plan is to have a robust menu of online, hybrid, and in-person courses to meet the student demand where the demand might be. So we know that we're going to have students that are hungry for the in-person contact, right? So we want to be able to have courses that address that. We also know that many students actually enjoy the flexibility of the online courses, and actually some students felt that they learn better there. So our plan moving forward is built. I mean, we actually had very little as a system online and hybrid before the pandemic. I think that this would allow us to sort of bring that up to maximize flexibility for those students who need it, for students who might still feel in the fall funny about returning to campus or taking public transportation. So our plan is to have a very robust menu so that if you're a student and you feel that you want to take most of your courses in person, they're there for you. If you're a student and you think that you want to mix that is more towards the online, that we have that. So I don't like to use the expression going back to normal because I thought that normal had very few offerings on the online. And I want that to be something that is, if anything, something that is positive coming out of the pandemic, that we have more faculty who are comfortable there and we have a more balanced set of options for the students.
And just my only follow-up question, I think, is will there be classes that are remote and classes that are in person? There won't be any hybrid.
No, they're three. We're going to have online, hybrid, and in person. And we actually have an investment to what they call HyFlex classrooms, which allow you to have the class with some students physically there and some online. And to add flexibility to the menu of options.
And I was joking about my last question. This might be my last question. Have you taken any polling or anything of students to figure out exactly where they might be in terms of preference?
Yes, we have. The challenging is that, and I think many of you are facing this in the council too, things are changing every 2 weeks, right? So the last poll we took was open 2 days right before the governor said all schools, all universities in the state of New York need to require students to be vaccinated, right? So that changes the whole set of questions. So we are working on getting another poll after that to capture But what we had basically is what I tell you. We had students that really wanted to be in person or mostly in person. And we had students who wanted to, even if they were vaccinated, they wanted the flexibility of online. So I think our duty is to have that robust menu for this fall and moving forward.
Got it. All right. Thank you. Thanks for answering the questions.
Chair Drum, are you there?
Yeah, I'm sorry. I thought council was going to call you, Chair Barron. So Chair Barron, why don't you, I know you have some questions.
Yes, thank you. I didn't want to just step in and take over, but I didn't see you or hear you, so I just didn't.
Oh, you're welcome to take over.
Thank you so much. I'm going to be extremely brief and ask that you also be extremely brief in your answers. First, responding to, this is not for you, but first responding to the comment by my colleague, Councilmember Landers. Yes, I think we do need to look at taking some action regarding the reluctance, the resistance, and the recalcitrance of making any substantive change to increasing the Black and Brown student population at Hunter College High School. And I'm excited about exploring what can be done. But getting back to the budget question, the committee requests a comprehensive Excel breakout, including all of the federal funding by aid package per fiscal year, crosswalked by community college, and we would like to have that by the end of next week. And it needs to be crystal clear for me and the body moving into negotiations so that we can support what it is that we want to have restored and clarified in the budget and make sure there's no sleight of hand. So we expect that. Will you be able to do that for us by the end of next week?
Yes.
Great, thank you so much. And in your new needs, there was a new initiative, the Institute for State and Local Government, the National Network for Safe Communities to End Gun Violence, and the People's Police Academy. Can you very succinctly tell us about these and which agency will be working with these initiatives? And is there any relation to increasing any funding to the police department based in any of these initiatives?
If you have that information, I don't have it offhand, so we can provide that to you.
Yeah, these are, the funding for the Institute of State and Local Governments and both the People's Police Academy was added to CUNY's budget. The People's Police Academy is part of Medgar Evers College, and they're providing services to various precincts throughout the city. And the Institute for State and Local Governance, the ISLG, will be providing services and expertise on the police reform initiatives that the mayor's office is putting forth.
Well, I certainly want to be a part of that and have some conversation about that, because when we had the police reform bill brought before us, there was a lot of discussion. People felt it was not grassroots based. They felt that there was not a respect for the ideas of how to really have a body that will be, in fact, held accountable for their misdeeds and misconduct. And this tinkers around the edge and does not really get to the heart of that, which is why I have introduced the Police Accountability Act, which says that we should eliminate the CCRB, have an elected body to review police conduct, and also have an independent prosecutor. But that's a whole nother hearing. And we will look for the answers that you give us for the questions in more detail, particularly if there's any kind of additional funding that would go to the police from this project that's moving forward. And lastly, there's also a Medgar Evers College healthcare pipeline. And how many full-time staff will be hired in connection to this program? And how many students will be involved? And are they only students enrolled at Medgar? So if you don't have that, you could send that to us. We would be happy to get that answer. And finally, There are 13 projects that are expected to be completed. And what will be the total value of all projects completed in fiscal 2021?
So I think on those,
Yeah.
we'll come back to
It's-
you the easiest
Yeah,
way. And on the Medgar, it will be anchored at Medgar, so mostly for those students, but remember that our students can transfer anywhere in the system, so.
Great.
And,
Thank
and
you.
Chair Barron, the value of the 13 projects completed was $124 million in the current fiscal year.
Thank you so much.
You're welcome.
Thank you to the panel for indulging us, and thank you to the chair for extending additional time. Thank you so much.
Okay, thank you very much. And we're going to end it here. I really appreciate you coming and staying with us, Chancellor Matos Rodriguez, and look forward to continuing to work with you. I want to say what a pleasure it has been working with you, I guess almost for 12 years now, if I'm not mistaken. But I really look forward to continuing our last 7 months, my last 7 months anyway, in the council with you and with CUNY. So we appreciate that, and we thank you again for coming in.
The feeling is mutual. To thank to the both chairs for your support and your commitment. Un abrazo.
Thank you. Un abrazo igual. Okay, and we're going to now move directly into our hearing with the Board of Election. And so just give us a couple of minutes to get set up, and then we'll start. But everybody should stay in this room. Sergeants, I'm ready whenever you're ready. And Chair Cabrera.
Ready, sir.
Okay.
And the Board of Elections, we'd like to do a sound check before we get going. Good afternoon. We hear you loud and clear. Thank you very much.
Okay, looks like we're good to go.
Okay. Thank you very much, Sergeant Polite. Good afternoon and welcome to the City Council's 8th day of hearings. Excuse me, I'm sorry. On the Mayor's Executive Budget for Fiscal 22. My name is Daniel Drum and I chair the Finance Committee. We just heard from CUNY and we will now hear from the Board of Elections. We are joined by the Committee on Governmental Operations, chaired by my colleague, Councilmember Fernando Cabrera. I understand that in the interest of time, he and I will both forego an opening statement, and I believe that the Board of Elections also is not going to be making an opening statement. So that will lead us right into questions. But we do have to swear you in. So I'm going to ask Council to swear in Dawn Sandow, Deputy Executive Director for the Board of Elections. And Council, would you do that now?
Absolutely. Just a few procedural items. Just as a reminder that everyone will be muted until recognized to speak, at which time they'll be unmuted by the Zoom host. If you mute yourself after you've been unmuted, it will need to be unmute again by the host. Please be aware that there could be a delay with unmuting and unmuting, so please be patient. Now with the affirmation. Deputy Executive Director Sandow, do you affirm that your testimony will be truthful to the best of your knowledge, information, and belief?
I do.
Thank you. You may begin when ready.
Okay, I don't think they're going to make an opening statement, so let me just jump right into, so I'm going to announce who's here first, and then I'll jump into questions. We have been joined by council members Darma Diaz, Maisel, Yeager, Kalos, Powers, and Cornegie. And let me also apologize for being behind. It's that time of year for us with budget, and there's just so much we can do in such a little time. But anyway, I thank you for being here. My first question is around absentee ballot reforms. The state's fiscal 2022 executive budget includes a proposal for absentee ballot reforms, which aims to extend the time voters have to request an absentee ballot and ensures a quick turnaround of a request. What, if any, operational impacts would this proposal have on the BOE if enacted? And do you anticipate this proposal having a financial impact on BOE? And if so, could you provide us with an estimate?
We don't see it having any impact on the board. We already now deal with special elections, and the deadline is 10 days prior to the election. And it all comes down to the data files and the data being transferred over to our poll pads. We don't see any impact.
Okay, thank you. And let me compliment you. I think it's your website, if I'm not mistaken, about requesting an absentee ballot, which I did do. And folks should know that it is available just by going to the website, or I think you have an app now. Can you give us a little advertisement on that?
We have updated our website continuously as election changes have evolved. And we have all information on RCV for this year's election in all required languages, 2-page ballot, all of our deadlines, voter guides, PSAs. As far as the absentee portal, if you're registered in the city of New York, you can go right into absentee voting, put in your information. It gives you, once you are confirmed, it gives you a confirmation number, which then you can use to track your ballot. It then tells you each process of where the ballot is: vendor, mailed, and out to the voter.
And can you give us the deadlines for the absentee ballot in particular?
Deadline is this.
To apply for an absentee ballot?
To apply for an absentee ballot?
Yes.
For the election.
7 days before the election.
So people have up until 7 days before the election to apply. Then they should get it in the mail. And then how long do they have to return it? Obviously, how long will they have to return it?
They have up until election day. It has to be postmarked.
Okay. What other preparations have you made for absentee ballots? Is there any other things that you could tell us about that?
Yes. Well, since last year, actually, during COVID with the executive orders, we basically, in about a month and a half, had our portal up and running. That's one. Number two is the absentee ballot voting equipment that we procured, which speeds up the process, especially since we had an enormous amount of absentees to deal with for the presidential. We also have a cure department now where the absentee ballots, if there's something that comes in and it can be cured, a voter receives 3 communications from the board: an email, a telephone call, and a letter stating that what the issue is with their absentee ballot, and that they have a certain amount of time to be able to come in and cure that. I think what else. That's about, yeah. It has increased the amount of space that we need in each borough office because the head count had to increase, of course, for early voting, and then absentee equipment in order to process all of these absentees. Not only did we hire permanent employees for the early voting, which was back in 2019, but now with the increase in responsibility with the absentees and the amount, we have more seasonal workers as well. And the equipment used also took up a tremendous amount of space. So we are short on space in all 5 boroughs and the executive office as well.
What type of space would you need? How large?
We would probably need, Jerry, I think it comes out to what?
In terms of square footage?
Square
I'm not
footage.
sure about-
We're working with OMB on the square footage, but and DCAS, but it's been a while. And I think I have it right here. Just give me a minute. So the board is proposing 16,000 to 22,000 of square feet added to the current borough offices and 18,000 square feet in the executive office at 32 Broadway. Also, because of COVID and all the plexiglass partitions that have been installed in all the borough offices to keep our staff safe, that also took up a tremendous amount of room.
Okay. Let me talk a little bit about ranked choice voting. Can you describe the work that the BOE has done with the Campaign Finance Board to ensure that voters are aware of the ranked choice, of what it is, and what voters will expect to see on the ballot?
We've worked closely with the Campaign Finance Board to make sure that the message is consistent. Although we were not mandated, we did a PSAs on our videos and a very diligent public education campaign. We did a mailing booklet to all registered voters. And it leveraged space in our legally required information notice to serve as educational and instructional on RCV, print and digital. The board has taken out print and digital advertisements in local newspapers, citywide publications, in all required newspapers in all 5 boroughs. The board has amplified all our messages on our social media channels. Like I previously said, the board created PSAs in all 5 languages and placed them on our website and promoted said videos digitally. Phone bank availability, the board has trained staff to be able to answer FAQs on RCV. Voters can call 866-VOTE-NYC and a representative in all covered languages will be able to answer their questions. Out-of-home advertisements, we have used digital ads using Link NYC kiosks across all 5 boroughs. Palm card distribution will be at all early voting sites and election day sites. We used them during the special election, and the feedback that we received, the Palm card has all the information a voter needs, and we received very good feedback on that. So we're continuing with that. We also used the design of the Palm card and created a 5-foot pop-up poster that will be prominently displayed at all sites, which serves as an instructional tool for not only RCV, but also an educational text on the 2-sheet ballot where it's applicable. Our privacy sleeve, so when the voter comes and gets their ballot, it gets put into a privacy sleeve. When they go over to the, what do you call that now? The privacy booth, and they open up their sleeve, the instructions for RCV is right on the inside for them to follow. We also put a message on our scanners so that when the voters go to vote, it's going to tell them to put in 1 ballot at a time so that they're not doing it too quickly to decrease any kind of jams. And I think that's about it. That's our public education.
Just to be sure that it's 2 pages, the ballot, right?
In some places, yes. I think in all. I think in all.
You know, okay. So they don't separate the pages, am I right?
The way we're packaging the pages for our poll workers, because we want to ensure that the poll workers are giving out 2 pages.
Right.
They will be packaged They're not going to be connected because we don't want to have any issues. We see that when we don't use the preparation, the ballot jams go down. So what we did is they're not connected, but there's page 1, page 2, and then there's a division, a blank page. So the poll workers know first 2 pages go to the voter into the privacy sleeve, and the blank page gets put into a recycling envelope. And then you're on to your next ballot packet.
And when you go to the scanner, you put in one page at a time. Is that how it works?
Yes, and there will be, when you lift up the scanner, there's going to be a message and it's going to state, please put in sheet 1. And then it'll say, please wait, and then please put in sheet 2, and then it'll say, thank you for voting.
Okay, thank you. Let me just go to some questions now about early voting. How will the board ensure that voters are aware of the early voting hours for the June primaries?
They're on our website and they're in all our advertisements.
And do the hours differ at the different sites, or how does that work?
No, the hours are the same across the board, and the commissioners have voted to increase the hours by 10. So voters will have more of an opportunity to vote, more hours. We also increased our early voting sites to 104 across the city.
Okay, I hope you'll add one more in Elmhurst. I think we're working on getting a letter for you for that, because the only one in Elmhurst is at the Elks Lodge, and it's kind of hard to get there. But I'll talk with you more about that offline. I don't know if you've received anything on that yet.
No, I haven't.
Okay. So just to go back to the hours, would it be standard hours from 9 to 5, or how does that work?
No, the hours differ. They're different on the weekends. I don't have, could you pull up the hours so I could read them at some point before we're done?
Yes.
We have 2 late nights during the week, which is mandated.
Okay, so how many
So
days?
I'm going to read them to you. Saturday and Sunday, it's 8 a.m. to 5 p.m. Monday, 7 a.m. to 4. Tuesday, 10 a.m. to 8 p.m. Wednesday is 10 a.m. to 8 p.m. Thursday is 10 a.m. to 8 p.m. Friday is 7 a.m. to 4 p.m. Saturday, 8 a.m. to 5 p.m. Sunday, 8 a.m. to 4 p.m. A 10-hour increase from 2020.
Okay, great. Now, I know that in the 2020 election, the general election, many New Yorkers waited in line for hours. Are there any steps that you've taken to decrease the waiting time and reduce it to less than 30 minutes to vote?
Yes, so we added the extra hours of voting. We added more poll sites, 104 across the city. We're using.
That's for the, I'm sorry, that's for the general, I mean, that's for the regular election day sites?
Yes, well, election day sites, the hours are the same. The hours are 6 a.m. to 9 p.m.
No, but I mean the,
We have over 12 for election day.
You said you added more sites.
For early voting. Are you talking about
okay.
just election day?
Yes, just for election day. I was wondering about that.
There are added sites for election day more than in the general election. We actually have line management workers, which we used in 2020, which was a positive. Line management will be directing voters that come in with an absentee ballot to go directly to an absentee ballot box that's located strategically in the poll site. We will also be helping voters online if they are. We're hoping they're not. But if they are, helping them to go to their specific ED if they don't know it. Our information notice that is sent out to the voter is with a FastPass tag. And they are able to take that tag to the voting site. It's contactless voting, but it speeds up the process. Here's a picture of what one looks like. I don't know.
It's hard to see. Yeah.
Okay, there's a code here. And when the voter goes to the ED table, this card gets placed into a square box on a mat right underneath the poll pad, and the voter's information immediately comes up. So they don't have to touch anything. We will be using the pens that also have, and it's a stylus and a pen, and they will be able to keep those pens so they don't, so there's no using other people's pens. So we've speeded up the process that way. Line management, fast pass tag, having people work the lines with a poll pad. We have people inside as well that will be directing people where to go. We've added quite an enormous amount of line management workers in each site.
Okay, thank you. I'm going to turn it over to my co-chair, Chair Cabrera.
Thank you so much, Chair Drum. First, let me thank you, Chair Drum. I don't think people realize, for those who are just tuning in, how many hours you're literally in every executive budget hearing, and not just for this year. You've done it every year. You've been the chair, so I salute you and great job. You're such a gentleman, and I honor you today.
Thank you.
My joy. Deputy Director, I have a few questions here, and welcome, and I want to thank your team. You guys did under the circumstances last year, a phenomenal job dealing with elections under the context of the pandemic. So I salute you and all the staff. Amazing job. I want to start with ranked choice voting software. 4 quick questions. I'm going to put them all together for the sake of time, because I know we have to get you out of here before 3 o'clock. And we apologize again for the late start. But to your knowledge, has the state board identified any significant technical issues with the software? When do you anticipate the board to complete the certification process? How will the BOE proceed if the state board does not certify the software in time for the June primaries? And what type of cybersecurity measures are in place to ensure the security of the RCV tabulation software?
First, the New York City Board and the New York State Board have been working very closely. We are not aware of any technical difficulties or significant technical issues with the software. It is our understanding and belief that the State Board expects to take action on approving, because it's not a certification, it's an approval. They will be approving the process of the RCV software at their next meeting on Tuesday, May 25th. As mandated by the city charter, if we don't have, which I don't even want to say it because it looks like everything is moving smoothly. But if we don't have the software as mandated by the city charter, we will move forward as we have in the past by doing a manual canvas, as we did with all the specials.
And cybersecurity measures?
Cybersecurity, we work closely with DoIT and also FireEye and Mandiant. We are looking to increase a headcount here at the board for not just RCV, but for all the changes to elections. It's important to note that as technology increases, also the threat of cybersecurity increases. So we are requesting staff, because we would like to have a cybersecurity unit here in the general office, and also units in each borough. I can send you, I don't know if I have it, I believe I do, but the actual amount, I think we requested 16 new employees for that specific unit. It's cybersecurity unit working with early voting. They're going to be, well, they say there's a bill that's going to have same day voter registration, which means our firewall things have to be protected, because that's going to be in real time data files that will be uploaded. So there needs to be a cybersecurity unit here in order to protect the agency. It would be 6 positions would be embedded within the EVS unit, which is our early voting system, our MIS department for our general office operations, senior security analysis and engineers, and network implementation engineers. The remaining 10 positions we would deploy to the 5 boroughs as supervisors of the newly created borough canvassing units dedicated to conducting daily routine cybersecurity checks and implementing necessary upgrades as new technology evolves.
Well, I appreciate that answer in light of what we just saw happen down south with the pipeline. And the last thing we need in this very important election to have a nightmare situation. I wanted to ask you, is there any way to use the software if the state board does not approve it? Han County at this, yeah, that would take, I would imagine, a month at least. So is there any way to use it without their approval, or is that something that you have to have the approval?
We have to have the approval.
Okay. So some people have been saying that it may take up to 10 rounds to determine a winner in the RCV elections. Can you clarify if that's true or not? I think I know the answer to that, but just so we can have it on the record. And also, has ESS met its contractual obligations?
ES&S has met its contractual obligations, yes, and it can take up to 10 rounds for RCV.
It could.
Yes, it could.
And what's the implication of that?
Well, the implication is timing. You know, it takes time. I mean, everybody has to remember that it's going to be the same process on election night. You're going to get your unofficial results, which we always do. And then there's the 7-day, which is normal. We get, you know, have to wait for our absentee ballots to come back. And it proceeds from there. That's where the change takes place a little bit. Absentees are due back. The election is the 22nd. So I think absentees are due back the 29th. If there is any absentee that comes back that needs a cure letter, of course, they're going to get the letter, they're going to get a telephone call, they're going to get an email. We have to wait for that to come back. The voter, we have to wait 7 days for the voter to respond, which then takes us to July 9th. And let's hope that there are no cure letters that have to go out, but it would take us to July 9th. And it's 7 business days that we have to wait. It's not 7 days. So considering we have a federal holiday, also the 4th of July that falls on the 5th, it would take us to start running the rounds the week of July 12th.
The week of July 12th, but help me understand, and just for clarification, since this
once all the rounds, once all the data is received, the software will make the rounds go very quickly.
That's what I was going to
go very quickly. I
so
mean,
really,
that's
it's not
the beauty of the software.
At the end of the day, it's not really about the software. The delay at all is all about, you know, waiting for the absentee ballots, everything else that you have mentioned.
Correct.
For the software, it's a matter of
right.
pushing a button, and then you got it.
Right. It's statutory requirements. That's what it is.
Got it. Let me move quickly here because I want to let my colleagues be able to jump in. Can you share with us how much has been spent on early voting in fiscal 2021 to date? How much you anticipate will be spent on early voting solely during the 2021 citywide primary election? Does BOE believe that the funding allocated in fiscal 2022 is enough to cover the costs associated with the 2021 and 2022 election cycle? Do you estimate you will require additional funding in fiscal 2022?
So for early voting in fiscal year 2021 to date, an estimated 18.5 million has been spent on early voting. The November general election was roughly 16 million for early voting. The board also conducted 5 special elections in fiscal year 2021. The Bronx City Council districts 11, 12, and 15, Queens City Council 24 and 31. The cost for each of these events for early voting is an estimate of 500,000 for a total of 2.5 million. We anticipate to spend early voting solely during the June 2021 citywide primary between 9 and 11 million. That's an estimate. That's on poll worker, public education, training, ballots, equipment, election supplies, PPE, and RCB. As far as the funding that's been allocated to us, do we have enough to cover? We most certainly do. And we would definitely, as we're sitting here today, I would be remiss not to mention and to state that the board is very thankful for the budget that we received.
Thank you, Deputy Director, for your straight to the point answers. I have 2 more categories, but I want to let my colleagues be able to ask their questions. And if hopefully I have time for this last little question. If not, we'll definitely submit it. So with that, I'll turn it over to Chair Drums for questions.
Actually, I'm just going to ask council to call the council members who have questions.
Sure. If any council member has questions, please use the Zoom raise hand function. Council members, please keep your questions to 5 minutes, including answers. Please wait for the Sergeant at Arms to let you know when your time begins. The Sergeant will then let you know when your time is up. We will now hear from Council Member Powers.
Time starts now.
Hello, sorry about that. Thank you, Chair. Thank you, everyone. Thank you, Board of Elections. I wanted to just talk about ranked choice voting for a second, as we are on the verge of a very, very big election, and not the first time, but obviously one of the biggest time we're going to be using ranked choice voting. And it's going to be a big learning experience, I think, for a lot of folks in the future about how it works and how voting behavior sort of works. So what I'm kind of curious about is how we are going to kind of see the results after Election Day. And maybe you can start by just walking me through, I want to get the status of the software being approved to make this work rapidly. And second is to get us, I think you guys have done timing a little bit, but I'm really kind of most interested in knowing is exactly how we're going to see the different iterations of voting rounds happening and what will be released to the public. So can you give me just and I'll have follow-up questions, but just a status on the software being used here, and second is how New Yorkers will see the different rounds take place and whether we'll get round by round information or we'll see just the final results.
Well, there have been alternative plans put together, and I think that once we receive approval on Tuesday, discussions, of course, will be made in public as to how we're going to proceed as far as what the public is going to see. Like I said to Chair Cabrera, on election night, you will see unofficial results, and that is for early voting and election day results as we normally have seen. As far as the alternatives, that's something the commissioners will have to approve. I believe that in the next coming week or so, they will be discussing that in public.
Discussing what in public?
The alternatives of what is going to be released, the timing of the release. Okay. That will be discussed as soon as the approval on Tuesday, May 25th. will be done.
And one of the questions I had about this election, and others have asked me, is whether you'll release the capital record here of which shows how each ballot ranked each choice. Whether you'll be releasing that.
That hasn't been determined yet, but I think that will be part of the discussion.
Okay, so when does that decision get made?
In the next few weeks.
Okay, the next few weeks is the election. So what
Well,
do we have?
I believe that the commissioners are waiting for Tuesday for the approval, and then the discussions will start regarding the alternatives to releasing information and what information will be released.
And what is the deadline to make a decision on that?
I would think in the next coming week, we will probably have a decision. I believe this will be discussed on Tuesday. However, I don't want to set an exact date to it. I know that their meeting is before ours. The state board is meeting at 12 noon. And we should have our answers before we go into our public session at 1:30. So I'm hoping for a discussion regarding the alternatives on Tuesday.
Okay, and then this was not released for the primaries. I mean, sorry, the special election to date, right? Is that correct?
I'm sorry, could you repeat that?
I said that data was not released for the special elections that have taken place to date. Is that correct?
Correct.
Okay, so but there is a potential possibility it would be available for this June's election, depending on what happens next week.
Correct.
That's correct. Okay. What do you see other constraints or concerns ahead? I mean, I'm concerned a little about the timing here because we're exactly a month away from primary day. Do you see other constraints or concerns right now in terms of timing or resources to implement successfully ranked choice voting?
No, I'm confident. I'm confident in the board. We did wait, and we had reasons for waiting to start our public education campaign, and it started in January. The reason why we waited was because we had a special election that was not ranked choice voting in December. We did not want to confuse voters. But since January, we hit the ground running, and we've worked closely with the administration. We've worked closely with CFB. We've worked closely with good government groups to ensure, excuse me?
So my time's expired. You can keep going.
Oh, I'm sorry. To ensure that the RCV information gets out there, and we worked very hard on keeping the message consistent and making sure that the voters for early voting and election day are going to walk into the poll site. They will see a 5-foot poster which gives direction for RCV. They will be handed a ballot and a palm card with the same information. And they will also receive the privacy sleeve with their ballot so that when they do go to the privacy booth, they have all the information right there. We are going to have people, line management, people at the sites that are going to be able to go and direct them to our PSA. Some people do better with watching visually, which is why we did the PSAs in all the required languages, than they do reading something. So we will have people at the sites with tablets for that if anyone comes over and has any questions.
And can I just one more question? I'm sorry to take more time, but why does it take 20 days after the primary to start counting the votes from ranked choice voting?
Can you repeat the question? I'm sorry.
As I understand it, it would take 20 days after election day to start counting the ranked choice voting. Is that correct?
Well, that all depends. Because of the statutory requirement with the absentees, it depends if we receive an absentee ballot that needs to be cured. We have to wait for that to be returned. Like I previously said, the election is the 22nd, and voters and the public will receive unofficial results, but we have to wait the 7 days for absentee ballots to be returned. Also, we may receive the following day an absentee ballot postmarked on election day. Every vote has to count. We must keep the privacy of the voter intact as well. And that's when we start going over our absentees. That whole week, that process, affidavits are done. All these are done preliminarily before the actual canvas starts. So if we receive on the 29th or the 30th an absentee ballot that needs a cure, it's going to have to, the voter will receive a phone call. The voter will receive an email. The voter will receive a letter as well, stating that they can cure and fix their ballot. We then have 7 days for that voter to respond to us. So that could be immediately, or that can be 7 days later, and it's 7 business days. It does not include weekends, which can take us to the 9th of July.
So now it's July 12th. You have everything you need.
Council
And
member, we're gonna have to move forward.
it's my last question. I just want to figure out timing. How quick will it take?
They have to leave by 3 o'clock, and I still have another council member that want. I'm so sorry. It's
Thank
out
you,
of my
Joe. No problem.
control.
No worries. Thank you, Joe.
I can answer your questions offline if you have any, just, we're always available.
Appreciate that. Thank you so much.
We will now hear from Councilmember Adams.
Time starts now.
Thank you very much, Chairs Drum, Marathon, my marathon hero here, my Finance Chair Drum, and Chair Cabrera, Co-Chair Cabrera, so great to see you as well. Thank you so much to the representatives from the BOE for being here today and providing us your insight and your testimony today. My questions are very brief. First of all, I'd like to compliment all of the folks that have given training. I think the training has been exceptional regarding ranked choice voting. I think the training, the presenters have all been fantastic. And we're still continuing to ramp up the training in Southeast Queens and my district as well. I've been on several of them, even though I probably still can't give one by myself. But I would like to compliment the trainers for doing a great job. My concern still is, however, the timeliness of the training, the feedback when it comes to people still feeling comfortable with ranked choice voting. And because Queens, we had several, at least 2-3 elections already, and looking at the feedback and the results from the recent elections in Queens, I'm still not getting a great feeling as far as the voters' feelings around utilizing ranked voting. So I guess I just want to know how you feel. How confident are you in the comfort of the voters in using ranked choice voting, particularly since we've had a few trials with it? I've seen the feedback in the press and spoken to some of the candidates as well. It's been interesting. I haven't seen anybody jumping up and down saying this is the greatest thing since sliced bread, which is what I really wanted to hear, given my very vocal apprehension around it. But we're looking right now at a tremendous election coming up on the 22nd. And I'm worried for you. I'm worried for us. I'm worried for New Yorkers. So how confident are you in voters' comfort with ranked choice voting? And I think that'll be my only question. Thank you.
Well, I'd like to go back to the special elections that took place in Queens. And I mean, I feel that the canvas process, the transparency was, we got nothing but complimented for it. We didn't have any issues in Queens, nor did we have any in the Bronx with their ranked choice voting. I know it was a very small area. We're not talking citywide. I think that between CFB, the Board of Elections, the mayor's office, and other good government groups, the message is out there. And listen, I think with change is very hard for people. And it's scary. Our young generation will take to it with no problem. We know that. We've seen that with the rollout in 2010 of the scanners. You've seen, the generational differences. The young people were able to come in, didn't have any issues. Our issues were more seniors. We are trying to hit as many senior centers. I mean, there's a lot of virtual webinars that are going on that we're partaking in. We're also partaking in webinars with the disability groups to reach out to those voters. I'm confident, however, the reason why we have the 5-foot posters in every poll site, the reason why we're handing out palm cards, the reason why we're putting instructions inside the privacy sleeve is because we never hit 5.5 million people with our message, and we know that. So we're preparing, and that's our preparation. Whoever we didn't hit is going to get hit when they come into the poll site with that information, whether they're going to read it on the 5-foot poster, whether they're going to get it from the palm card, it's going to be inside the privacy sleeve, or they're going to go over to our information clerk who does and will, you know, not only the information clerk, line management, they will have tablets. Like I said, not everybody can pick up by reading something. So we will have the PSA where we'll be able to play a video for someone and actually they will be able to watch it and go through the whole process. So I think we're trying our best at all different angles to ensure we hit all voters with our message for ranked choice voting and 2-page ballot.
I appreciate your response, and I will just reiterate the fact that I think the training is really good, and also I'm going to reiterate.
Thank you so much.
You're welcome. But I'm also going to reiterate my concern with the magnitude of what we're looking at right now on the 22nd. And my hope is that we all get through this as painlessly as possible. Thank you for your testimony.
Thank you.
Thank you very much. Chair Cabrera, do you want to wrap it up?
Yes, I just want to thank you, Deputy Director, for your information. We're going to be submitting the questions. I know you have to go to another meeting and time has eluded us here, but thank you again for giving us an update. Looking forward to Tuesday's response from the state to finally, hopefully we get this software approved. And so with that, thank you. And I'll turn it back to the chair as we move now to CFB.
Thank you,
Okay.
Chair Cabrera.
Thank you very much, Chair Cabrera. This is going to end our session with the BOE. Let me just read this statement. Bear with me a moment. This will conclude this portion of today's hearing. Thank you, BOE, for being here. We will now move on to the Campaign Finance Board. I ask my colleagues who will be joining us for the CFB portion of the hearing to remain in this Zoom. And I just want to take a 5-minute break if I can, and then we'll come back, okay? To give everybody time to get set up, but in 5 minutes, we will be back.
only to their
Sergeants, I'm back.
Ready.
You ready? Chair?
All systems say go with you always. Come on.
All right. Just want to get a sergeant to test their mics.
Yes, folks from CFB, if we can test your audio.
Okay. Amy Loprest? Is that working?
Amy, we hear you loud and clear. Thank you.
Frederick Schaefer.
Yes, Frederick, we hear you loud and clear. Thank you very much. Is that all, the two of you? Okay, chairs, it looks like we're ready to go.
All right.
Chair Drama, I'll for the sake of time, because I know we're way behind here, I'll forfeit my intro.
Okay, very good. And so will I. But let me just do this introduction here. Good afternoon and welcome to the City Council's 8th day of hearings on the Mayor's executive budget for fiscal 22. My name is Daniel Drum and I chair the Finance Committee. We previously heard from the Board of Elections and now we will hear from the Campaign Finance Board. We are joined by the Committee on Governmental Operations, chaired by my esteemed colleague, Councilmember Fernando Cabrera. Let me just see if I have the names of those who have joined us. Yes. We have Councilmember Adams, Amphrey Samuel, Ayala, Barron, Darma Diaz, Gibson, Koslowitz, and I'm sorry, Koslowitz was with us also for the Board of Elections, Lewis, Riley, Rosenthal, Yeager, and Minority Leader Madio are with us. And now we're going to hear testimony from the Campaign Finance Board. We're joined by Frederick Schaefer, Chair of the CFB, and Amy Loprest, CFB Executive Director. But before we begin, I'm going to turn it over to Committee Counsel to go over some procedural items and to swear in the witness.
Thank you, Chair. I want to remind everyone that you will be mute until you are recognized to speak, at which time you'll be unmuted by the Zoom host. If you mute yourself after you've been unmuted, you will need to be unmuted again by the host. Please be aware that there could be a delay in muting and unmuting. I will now administer the affirmation. Do you affirm that your testimony will be truthful to the best of your knowledge, information, and belief? Executive Director Amy Loprest?
Yes.
And Chair Rick Schaefer?
Yes.
Thank you. Ms. Loprest, you may begin when ready.
Okay, thank you very much. Good afternoon, Chair Cabrera, Chair Drum, and members of the Committees on Governmental Operations and Finance. I'm Amy Loprest, Executive Director of the New York City Campaign Finance Board. With me today is Board Chair Frederick Schaefer. Thank you for the opportunity to provide testimony on our budget for fiscal year 2022 and answer any questions you may have. The CFB's fiscal year budget request is $72,422,974. It reflects a slight decrease in other than personnel services and a slight increase in personal services. Please note that the budget includes approximately $10.275 million for printing and mailing a citywide voter guide for the 2021 general election. The budget also includes $40.8 million for public funds payments for the general election. Like other parts of the government, we were forced to rethink how we conduct our work during the COVID pandemic. Most of our staff were forced to adopt to remote work to conduct voter outreach for a crucial presidential election and administer the biggest election in the history of the Matching Funds program. Despite these challenges, CFB staff continue to admirably perform their jobs at a high level and should be commended. In addition to the difficulties brought on by the COVID pandemic, 2021 was the first election cycle to fully incorporate changes from the Mayor's 2018 Charter Revision Commission, Local Law 128 of 2019, and the Council's 2019 Charter Revision Commission. Some of the most significant changes include early disbursements of public funds, an increase in the matching rate from 6-to-1 to 8-to-1, while also allowing candidates to run under the 6-to-1 system, an increased public funds cap with larger payments, and the mandate to implement a robust public education campaign for ranked choice voting. The 2021 election has been the largest in the history of the Matching Funds program. At one point, as many as 579 active candidates were registered with the CFB, which is an all-time high. For reference, the previous high was 390 candidates in 2001. With so many candidates running for office this year, work has increased substantially across the agency, particularly for our audit and candidate guidance and policy teams. To date, the CFB has paid out almost $76 million to 250 candidates participating in the elections. That's another all-time high. To date, 104 candidates running for office in 2021 have received the maximum payment available under the law, and 194 first-time candidates have received a public funds payment. There are 2 additional payment dates left before the June 22nd primary. We have allocated a total of $96.5 million for public fund matching funds payments in the current fiscal year. This year, we have also rolled out technology improvements to enhance the candidate experience. As many of you know, we recently launched the CFB portal to make it simpler for candidates, treasurers, and campaign staff to keep track of campaign tasks and communications with the agency. The portal will make it easier for campaigns to update their registration information and to respond to compliance or audit requests. For future elections, it will allow all candidates and political committees to register online, eliminating any paper forms. This is part of the first phase of a larger project to overhaul our legacy database and update its technical infrastructure. Further, we have made improvements to our NYC Votes Contribute fundraising platform, including a new feature that allows campaigns to organize and report fundraising events using the system. At a time when in-person fundraising was nearly impossible, we aim to make online fundraising as seamless as possible. Between January 12, 2018 and April 30th, 2021, 417 campaigns used NYC Votes Contribute. Over that same period, a total of $14.5 million was raised from almost 124,000 contributions. We will continue to make enhancements to the platform throughout the fiscal year 2022. An increase in the number of candidates running also calls for a more expansive voter guide and debates program. As you know, the voter guide is mailed to every household with a registered voter in New York City. We have invested significant time and resources in redesigning the voter guide to engage as many New Yorkers as possible and to prominently feature information on ranked choice voting. Ranked choice voting is featured on the cover of the primary election voter guide and includes tools that prompt voters to consider their rankings. We have also successfully completed work on our video voter guide, which includes American Sign Language interpretations and was filmed, produced, and scheduled entirely remotely for the first time. Our debate program kicked off this month with the first Democratic mayoral debate on Thursday, May 13th. The first Republican mayoral debate is scheduled for Wednesday, May 26th. With a diverse and expansive field of mayoral candidates, we added a third debate to the official schedule. Our debate partners have done a phenomenal job balancing the safety of candidates and their production staff, while also making sure New Yorkers are presented with a meaningful discussion of the issues at stake in this year's election. In addition to incorporating RCV into our voter guide and debate program, the CFB has also conducted a carefully planned voter education campaign to inform voters about ranked choice voting. To date, staff has conducted well over 100 training sessions with community groups, religious organizations, senior centers, and elected officials, training over 7,000 New Yorkers so far. Early returns suggest that our outreach is effective. According to EDSIC surveys conducted by Common Cause New York and Rank the Vote in NYC, after special elections in council districts 24, 31, 11, and 15, the first to use ranked choice voting, 95% of respondents found the ballot simple and easy to use, remaining true across gender and education levels. Further, over 75% of respondents were very or somewhat familiar with ranked choice voting prior to casting a ballot. An additional 61% of respondents also ranked more than one candidate. As mentioned earlier, ranked choice voting will be featured prominently in our primary election voter guide. Much of the $2 million we're spending on ranked choice voting will be dedicated to our advertising campaign, which recently went into full effect. Our ad campaign prominently displays ranked choice voting in public spaces like bus shelters, television and streaming services, radio, social media, and community and ethnic print media. Before early voting begins, we will also kick off our volunteer-led text banks, which will directly inform New Yorkers about ranked choice voting. To complement this work, we have recently unveiled branding and website updates to voting.nyc website. The new design elements and digital tools are grounded in the needs, questions, and issues that matter to New York City voters, which were identified and validated in research in early 2021. We are thrilled that the mayor's office has dedicated an additional $15 million in ranked choice voting education funding. It will help take from all levels of government to ensure New Yorkers know how to cast a ranked choice ballot. And we look forward to continuing our partnerships with Democracy NYC, the Civic Engagement Commission, and the Board of Elections in the City of New York to get this important work done. The 2021 elections represent the first instance in our experience where the primary and general elections are split across 2 fiscal years. As we move ahead into fiscal year 2021, our work administering the public matching funds program, overseeing the debate program, general election, and producing a general election voter guide, which will include matter on at least 2 constitutional amendments. Our budget contains a slight increase in personal services and an increase in the cost of the voter guide. Overall, the fiscal year 2022's budget request is over $34 million lower than fiscal year 2021, primarily due to the anticipated decrease in the anticipated public funds disbursements. Thank you again for the opportunity to testify. I'm happy to answer any questions you may have.
Thank you very much, Executive Director Loprest. Let me start off by saying this is the final budget hearings that I will conduct as chair of the Finance Committee, and I'm term limited out at the end of the year. But I do want to thank the CFB for providing the funding. In 2009, when I first ran as a participating member, I don't believe that I ever would have been able to have run if it were not for the New York City campaign finance funding that has been provided. So I do want to thank you, even though sometimes I was annoyed by your rules, but I don't think I'd be where I'm at if it wasn't for this fantastic program. So thank you for your leadership and your direction as well.
Well, thank you so much for your service over the past years. It's been really admirable.
Thank you very, very much. Yeah, I wish it could be longer, but I'm in favor of term limits. So got to move on. In CFB's executive budget, 39.8 million more was allocated to the public funds matching program for fiscal 22, bringing the total budget for next year to 40.8 million. According to Checkbook New York City, the board's current year commitments for the program total 96.5 million, and yet its fiscal 2021 budget still only includes 65.5 million for the program. How much funding will be added to CFB's fiscal 21 budget for the public matching funds program, and when will it be added?
So that's the additional, I'm not going to do math in my head, but I think it's about $20 million has already been added to the CFB's budget for the public fund, the final 2 public funds payments that will occur in fiscal year 2021. It reflects our anticipated total of $96.5 million in payments for fiscal 2021, basically for the primary election, but also that included the payments for all of the special elections that occurred earlier this year.
Okay, great. And how does this relate to the board's vote to raise the spending limit for participating mayoral candidates in April 21?
The increase in the spending limit does not come with an increase in public funds payments because the Supreme Court's decisions prevented you giving any additional public funds for increased spending. So we can increase spending, but we can't give any additional public funds. So there's no change in the maximum.
There's no change. Okay.
Is the short answer.
Okay, thank you. How does the funding for this program compare to the amount of independent spending in the election cycle so far?
Well, again, the independent spending, we'll see today as a filing day. So we will see, the spending reported, but I defer, if our chair has anything else to add to, to that answer. But again, we're expecting the disclosure today.
I'm hearing it's going to be a lot of money, so I'm looking forward to see what that looks like later on once you can compile those figures.
Yes,
Chair, did
of
you want
course.
to say anything? Chair Schaefer?
No, just to point out the obvious, which is that this is the first citywide campaign, particularly for mayor, where we've seen very large amounts of independent
Yes.
expenditures. And it's also the first in which we've seen a prevalence of single candidate PACs, which raises some interesting questions that we'll have to look at after the election cycle is over in terms of how we may want to modify either the law or our rules.
Yes, I agree. Yeah, and then some of the news stories I'm reading on that topic as well seem to indicate the same thing. So, thank you.
Of course, just point out that so far to date, the board has paid out $23.5 million to 7 mayoral candidates. So that certainly will help combat the influence of those large independent spenders.
And absolutely. Does the board have an opinion on whether the spending limit should be raised in instances where there is a significant amount of independent spending in a race?
I think that that's an interesting question. I think it was looked at in previous years. I think that as Chair Schaefer said, this is the first year where we have seen really this increase, and certainly the increase in single candidate super PACs. So I think it is definitely one of the interesting factors that we will look at the end of the election.
Okay, but no definite opinion at this point?
Again, I would like to see, we'd like to make database decisions and recommendations. And I think that, the city council wisely, when they passed the law, added a provision that we review the program after every election. And so I think that comprehensive review will be a place to really look at this spending and see if that kind of change is warranted.
Thank you. Okay. Can you provide us with a breakdown of the current fiscal year's public matching fund program budget for the individual local races?
Okay, so we have paid out so far, as I said, we have paid out about $23.5 million in the mayoral race. We have paid out almost $12.6 million in the controller race, $12.2 million in the borough president races, and about $27.6 million in the city council races, for a total of about $76 million.
Okay, thank you. And what is the board's estimate of anticipated expenses for the matching funds program in fiscal 22? And is it different than the $40.8 million that's already in the budget? When do you expect that to be reconciled?
So the $40.8 million is what we anticipate paying out for the general election. So so that does reflect our budget, our estimate for the general election.
Okay, all right, thank you. Let's just see, on April 28th, Mayor de Blasio and Democracy New York City announced a $15 million voter education campaign to inform New Yorkers of ranked choice voting ahead of the June primaries. The funding will go to a citywide media campaign, language access and accessibility resources, and direct outreach. Is Democracy New York City coordinating this campaign with the work that CFB is already doing?
So yes, we have been working directly with Democracy NYC and will continue doing so. We've been working with them throughout the election year, and we'll continue to work with them to coordinate our messaging about ranked choice voting as that $15 million is spent.
And do you expect to see any of that 15 million?
So they have already spent about $400,000 to amplify our advertising campaign. While we have not, we haven't received any of that money directly, they will be amplifying our messages.
Okay. All right. Thank you very much. I'm going to turn it over to my co-chair, Chair Cabrera, for other questions.
Thank you so much, Chair Drum, and I share your sentiments, especially someone that was not familiar much with politics in 2009. The matching program really was a big reason why I'm here, especially in a district like mine, where it's very hard to raise funds. And so I'm a believer in the matching. And I'm even more a believer with the 8-to-1.
And Chair Cabrera, if I may say also, we came in together and we've had a great tenure together. We were newbies together. So
it was fun. It's been a really good ride, Chair. Yeah. It's been a really good ride. It's an honor to be one of the only 51 New York City Council member. I'm still standing in awe of that privilege in the greatest nation in the planet Earth, and a pleasure working with you. And thank you for your leadership and my colleagues as well. I want to say, Executive Director, first, let me just commend you on the RCV commercial I saw it the other day. It was very good. I tell you, a teenager, a young person can really understand it. And that was my biggest concern. And when we had a hearing before, I talked a lot about the marketing piece and television. And I had to salute you and your team. Not only that you had the commercial, but how you put forth the commercial. And so it leaves no doubt that anybody could really understand how it works, and using television is a great way. And let me ask you a question related to the funding that we have received. Are we now, and I'm basing this in the last hearing, now we are putting more funds towards RCV education than any other municipality in the United States?
I imagine with the $15 million that we are, but I would not want to say definitively. I'm not sure, but I think probably, with that additional $15 million, it's likely.
I think that we are. We're at 2.7 before, and some of my colleagues were concerned about that. And I did the math when we were comparing to Oakland and in San Francisco, that we needed at least 6.7 to be able to match what they were doing. And now we're 15. It leaves no doubt, at least in my mind, that at least we have the resources, how it's utilized. And I'm looking forward to seeing more of it. I have received literature, I hope. I was gonna ask you, how much has the CFB spent to date? I don't know if you mentioned that before. If you did, I apologize.
I don't think I did mention how much we spent to date. I mean, I think that it's, we're starting our advertising and voter guide campaign is just, it's just starting. So we will be spending, aside from the amount that's spending for the voter guide, which, includes a lot of information about ranked choice voting, we will be spending about $2 million in outreach, which includes, paid media campaign, again, as I mentioned, on bus shelters, on social media, and television, radio, and print, including the community and ethnic media, print media. And also, that $2 million includes the amount that we are spending for our postcard mailing and our Get Out the Vote text bank. So I know that I received my RCV postcard in the mail yesterday. So I imagine some of you have received yours. Again, that postcard, thanks to legislation passed by the City Council, has gone to every every voter in the city of New York to inform them about
And
ranked choice voting.
I certainly received mine and I loved it. When do you anticipate, when do we should anticipate receiving the voter's guide?
It should be going into the mail towards the end of May and going into the mail stream and then arriving in people's mailboxes, around the beginning of June. The online voter guide will be appearing, the beginning of June. So you'll be able to see the online voter guide, which will, in addition to voting.nyc, which has some additional technical enhancements to show you how ranked choice voting works. You can now look at that. It's live now. You can look at it and do a mock election and practice ranked choice voting. When the online voter guide appears, you'll be able to look at your candidates and kind of keep track of ranking them the same way there'll be tools for ranking your choices in the print voter guide.
I know this is short notice, but I was thinking about, and we literally ran out of time, and talking with BOE and no fault of their own at all. But I was thinking about, is there going to be a video that shows you what to do when you get to the voting site? So, for example, the questions that we've been asking here today, we're elected officials, some of us are running. I can imagine the public at large, right? It's going to be perforated. If I bring that ID that was given to me, how do I use it? Do I use it at all? Is it possible to do a quick video that shows this is what, each stage once they go to the voting site?
Well, I do know, in addition to the television commercial that we have that you referenced, we also have a video that tells people exactly how to mark their ballot. So it has, step by step. I understood, and again, I'm not going to speak for the Board of Elections, but I understood from what Deputy Secretary Sandow said is that they have a video also that tells you how to use it, and that they're going to have the facility to play that for people who that is more helpful than the printed materials that they're going to have available.
Thank you for that. The last special elections, I know we had here in the Bronx, was it Queens, Brooklyn. What percentage of people ranked choice? You did mention it, but
I have to look that up again. I think that it is that 61% of the voters ranked more than one candidate.
What would you see as a win in this coming election? Primary. What percentage?
I think that, I think what one thing is that to make sure that to have people have the familiarity. And again, it's hard to know. It depends on the race. Obviously people should vote for the candidates that they want. So, they should, if they only, are like one candidate, then they can vote for one single candidate in a race. But I think, having people, having utilization, that 61% was very heartening to see that 61% of voters actually ranked more than one candidate. So, I think that's a great statistic.
Two quick question. You mentioned there's 2 more payment days. What are those days?
One is next Thursday, which if I look at my calendar, if you indulge me, I can tell you the date. It is next Thursday, May 27th, and the final payment is on Thursday, June 17th.
And my last question is, you received $15 million. If are you anticipating you're going to use it all? Or are you just gonna strategically move and see as the need arises? What do you anticipate?
Well, again, the $15 million is the mayor's, the Democracy NYC's budget, and from what I understand, and certainly I think what the plans is to use the vast majority of that $15 million to do a robust advertising campaign about ranked choice voting.
Great, thank you so much. I think I'm done with my questions. Let me turn it back to the chair. I know we have colleagues that have questions. Thank you so much, Executive Director.
We're going to go to Councilmember Rosenthal.
Time starts now.
Chair Cabrera, you asked my question. So I'm looking to see if I
Always
maybe
have
haven't
one
fluent.
there. Come on, you always have an extra
No.
inside higher level question.
Yeah, it's the last budget hearing. I'm out. But no, I just really want to thank you for all your work. I mean, this is critical. I think, you know, I think what Chair Cabrera was getting at is, you know, and I share his frustration. The 15 million came a little late, and I hope we're going to get $15 million worth of good media, and really get into additional communities.
And I think that is the plan. And again, to use a lot, you know, money for translation and for, you know, outreach to, you know, ethnic and community newspapers, and make sure that everyone across the whole city really understands that this is happening.
Yeah, I mean, my 2 cents is that I don't quite understand why you're doing education, and then there's the mayor's office that's doing education. I'm just hoping that there's some sort of coordination, and that, you know, if each of you have limitations that the other is picking up. It's just so important. And I think recent polls have shown, you know, how few people really understand what ranked choice voting is. I definitely get questions in my office. So I know the big push is on, and good luck. I wish you had more money.
So, you know, just so you know that, I mean, over the past year, we have developed, you know, at the staff level, developed a really strong collaboration with Democracy NYC, with the Board of Elections, with the other people working in the civic community on election issues. And it was absolutely necessary. I mean, you know, in last spring, when the things were changing about the election every week, you know, information, it was incredibly vital to make sure that we had a strong collaboration. And that partnership and work that we've done, you know, that foundation that we've built will definitely be brought forward to the ranked choice voting education.
Do you happen to know if anyone is going to use the space in the samuzas, the bus shelters, where you can put in huge posters? We actually did that for Student Voter Registration Day, and it would be amazing to have a huge poster showing the ballot and, you know, 1, 2, 3, and demonstrating, you know, some sort of infographic.
Yeah, our advertising campaign includes bus shelters, the bus shelters. Also, I think there's some plans to work with the name just went out of my head, the digital platform, Link NYC, Link NYC kiosks across the city too.
And so have those already rolled out? I mean, the fact that I'm not seeing it in my district means my district's not targeted, or that it hasn't been rolled out yet?
I think it's beginning to be rolled out. So I think, you know, probably in the next weeks or so, again, they are targeted campaigns. So, you know, again, we can't be in every bus shelter in every district, but I mean, there will be targeted campaigns. So, but they should be rolling out soon.
Yeah, I just want to make sure we're putting enough money to it. Mm-hmm. Yeah. Thank you so much. Thank you, chairs.
Thank you very much, Chair Cabrera. Anything else?
No, I'll make is this the time for a closing remark?
Yes, and I want to make a closing remark, but go right ahead, sir.
Thank you. Thank you so much. First, Chair Drum, this is my last executive budget with you. I get emotional because this has been a good ride. We've done well, and so proud of the work that you have done. You've done an amazing job, and you've done it with integrity. You've done it with honor. You've done it with respect to all the members and consideration. I thank you. I thank you for all the work. You made us all better through the budget and through the coalition that is required to do this level of work. So I salute you. I can't say enough. I also, in closing, I want to say, and Chair Drum, help me with this. Right now, and I didn't mention at the beginning because we were trying to save time, community boards, right now, they have been cut between the initiative that we lost last year, $4,500, between the 5,000 plus that was cut already this year and another 8,000 in this budget. We're talking about a 20% cut. And they're a government institution. And we're talking about less than $700,000 to restore this 8,000 and so funding. We really need help, and I'm calling the administration to restore every single penny, not just the 8,000 and so for this year, but the last fiscal year, the 5,000. They need to be restored. Right now, where else are they going to cut? And some of them service an area larger than council members do, with limited resources and dealing with 50 community board members. It's just, they deserve better. They have little resources as it stand. And then also, let me just say, serving in this committee in my last executive budget hearing, I want to thank the staff. They've been nothing but amazing. They're truly have been the dream team that any council member could have asked for. And I salute every single one of them for making my job an enjoyable one. And I'm not done with them yet with other things, but in terms of this executive budget, I want to thank them. So, Señor Chair, te los regreso para atrás.
Igual, gracias. And I want to say thank you, Chair Cabrera. He's done an amazing job, and it's been such a pleasure and an honor to be able to work with you these last 12 years. And I'm very, very proud of what you've done, what we've done together. And I look forward to continuing that, as we still have 7 months left, so we can still do a lot of good left. And thank you, Chair Cabrera, for everything you said about me as well. And to CFB, I just want to say thank you also for coming in. I want to brag. I mentioned the pesky rules that you have, but I actually never got a fine, no fine, 3 elections. So I'm a happy camper. And I thank you for all the work that you've done as well. Thank you to Chair Schaefer, and thank you, of course, to Executive Director Amy Loprest. We appreciate you coming in and giving us information today. So this will conclude today's hearing. Thank you, CFB, for being here. Before we close, I'd like to remind the Finance Committee members that we will be meeting remotely again on Monday, May 24th at 10 a.m. And we will hear from the Office of Management and Budget, the Controller, and the Independent Budget Office. And as a reminder to the public, the committee will be holding a remote hearing for public testimony on the executive budget on Tuesday, May 25th at 10 a.m. If you would like to testify at that hearing, please register at www.council.nyc.gov/testify, and information about how to access the Zoom meeting will be emailed to you. You may also submit written testimony through that registration website or by emailing testimony@council.nyc.gov. Thank you again to everyone. Thank you to our sergeants again. Thank you to all of the finance team members, to my council, to Stephanie Ruiz, to Regina Pareda Ryan, to LaTanya McKinney. Thank you, CFB. We're done. This meeting is, just let me see the time. This meeting is adjourned at 3:43 in the afternoon.